people is leaving a mark in our country. We wish to present our regard to Ms. Jimena Aguilera, Health Minister from Chile.
Muchas gracias por el saludo.
Thank you so much for your kind regards. Welcome. Good morning to everybody. Allow me to welcome you to this long land region, as we Chileans say. I will try to speak slowly for the simultaneous translation. Dear ladies and gentlemen, ministers of health, 5 ministers, Ms. Adjunta Director from the Pan American Association of Health, dear Marilu Valdez, representative from the Pan American Organization of Health. I'd like to present my kind regards to the Director of Holistic Integrated Systems of Health visiting us, Dr. Villegas. Ladies and gentlemen, leaders from the 42 delegations from countries that have responded to this calling, colleagues from the International Committee for the Summits, authorities, and national representatives, ladies and gentlemen, we still know how difficult it is to come to Chile. We are so far away from the centers where most of the people live in. And we thank for the sacrifice it means to travel such long distances and truly be a part of this conference that aims to topics so relevant, as it was mentioned by the World Health Organization director. It is a topic that might mean that there's lack of safety and may cause 3 million of deaths on a yearly basis, and half of them are avoidable. Oh, my regards to the members of the parliament that are present. Ms. Molina, ex-Minister of Health. Yes. To us, it is an honor to be part of the countries that reaffirm the commitment to people's well-being. These ministerial global summits on patient safety have become a very successful platform as a response from the government to the challenges that have been stated, also to exchange experiences and for international cooperation. You know how varied it is, the delegations that are here present, representatives from all the sectors, from all the regions in the world. It's extremely important to us as a country to have had the opportunity to be the organizers, the host of this summit, and for the summits to be performed and to continue to participate with the different countries and the different regions in the world. From the first summit from year 2016, we have had dialogues that go from the highest level and call upon the different communities, the different organizations, and different interested parties in patients' safety, including the patients themselves. They are a very relevant voice that we need to hear as people working in healthcare. Along years, the dialogue has managed to align policies, communities, and financial systems, position their message as a key component in universal sanitary coverage. There's no universal coverage without safety. There's no universal coverage without quality, because all the efforts we perform in terms of access and equality are vain if they do not represent a care that provides safety to the patients and that is also received by the patient. That is the key thing from this mandate. Universal coverage demands for quality and safety. If not, it does not exist. So we celebrate enjoying the publication on behalf of the World Health Organization on the first action plan for patient safety 2021-2030 that builds and guides a roadmap that guides the member state in the decision-making process and the implementation of strategies in order to safeguard for the safety and care as a main access and sanitary policies. I invite you to join to this path in a joint fashion with all the countries and to embrace the commitment that the World Health Organization is providing and the Pan American Association for Health, as Marilu Valdez mentioned. So we all must be connected in this region, moving forward in this roadmap and all together as a world, as countries in the world, in the roadmap stated by World Health Organization. For this summit 2024, Chile states the challenge of diving in how the different states have managed to implement, develop, and provide sustainability to different strategies so we can provide safe healthcare in the framework of the 7 strategic objectives in the action plan, global action plan for patient safety. So in this perspective, I want to speak a little bit about what has happened in this country. Patient safety has a development consistent in this country that goes from government to government, has been a state commitment in the development of the health system. This year, we commemorate 100 years of the creation of the health ministry in Chile, one of the oldest ministries in the region. From the creation of health ministry, and even before health ministry, we need to provide testimony to the commitment taken over even before that date with health protection. We have moved forward in a sanitary system for social protection. We're also complying 100 years since the first social security law here in Chile that allows full enjoyment of rights of their inhabitants without differentiation in category. From the first actions implemented for healthcare, we have managed in a progressive way to improve the provision of sanitary services, making them more reliable and safer. We have moved forward in the establishment of minimum standards and their assessment for attention and regulation of the profession of the health sector. We are going to commemorate 20 years from the plan of explicit warranties in health that was promoted during the presidency of President Ricardo Lagos. Fortunately, I was lucky enough to collaborate with it by being an officer from the Ministry of Health. That law, 20 years since next year, included for the first time quality warranties for health patients. This is related to the crediting of the establishment and also certification of the health professionals. Those are key points regarding on how we have moved forward in safety. Among the most recent achievement in this area as a change engine, it is hospitality safety that quantifies quality losses, knows about risk factors, and makes an assessment of the different interventions with the patients. In compliance, we have incorporated different tools, such as artificial intelligence, that allows to analyze large and complex databases, medicine based on evidence that provides information on efficient interventions, inclusion of social sciences and behavior, in order to know about the different motivations of the workers, sanitary workers, and social organizations in terms of safety and the demand coming from the communities. They are protagonists more and more on their safety in sanitary terms. Certainly, despite what we have done, we have multiple challenges that have also been more severe because of the pandemics. The health system have received a huge impact, and we still are challenged in overcoming everything related to attention and how we can provide care by keeping quality and safety despite the pressure we have on health systems. I would like to highlight specifically the people that have been part, that have been developing the first structural initiative regarding patient safety in the prevention programs, infection control programs associated to healthcare. They were born as interhospitalized infection programs approximately 40 years ago, since the second half of the last century, not only providing results in the improvement of safety, but reducing costs caused by infections, and have been a key component in the preparation and response to the pandemics, as we have proved in the last events we've had to face. However, as I said, we know we have multiple challenges. They demand adapting national programs to the different healthcare systems, restrictions, economical restrictions, and the sanitary context. To us, we have the challenge of incorporating in the best way, in the most productive way, the voice of the patients in all issues related to safety in care. That's why I celebrate this encounter, and I make a calling to WHO on the urgency to install concrete actions for patients' safety, to establish solidarity with sick people as a basic principle, and to communicate the population in the perspective of humanization of services and response provided to our communities, to establish communities for safety of patients, does require for a political commitment and the leadership of governments. We've learned that this means fundamental elements for the development of local actions that implies the implementation of itinerary mechanisms and objectives for health institutions to be able to report required results in areas of continuous improvement. I appreciate your commitment with people, because everything we do revolves again the well-being of those who are under our umbrella of responsibility and those working in this health environment. Well, I wish for you to have a successful meeting with analysis on the different commitments. Thank you so much.
Muchísimas gracias, señora ministra.
Thank you so much, Ms. Minister, for your kind words, for your regards, and also for speaking about what we're doing here in our country. In the landscape of healthcare services globally, this is experiencing different changes. Health systems operate in more and environments that are very difficult and getting more difficult with new treatments, new technologies, and care systems. Even though this evolution present a theoretical evolution, they also present new threats for health of patients. Health safety is a global challenge that is increasing. Now, despite the efforts performed for over a decade to reduce damages in patients, safety measurements that have been implemented so far have had a limited impact. So we are facing a concerning reality, but also a unique opportunity. This summit will provide the opportunity to know about the experience and knowledge and challenges regarding complexity of improving safety in healthcare in a changing world through, well, we present through the vision of Sir Liam Donaldson, the special video from General Director of World Health Organization. A big round of applause.
Good morning, especially to the honourable ministers who are joining us for the day, having had yesterday our expert discussion, and you'll be hearing more about the output of that discussion later. I saw my first death from unsafe care when I was a young medical officer in 1986. That was 40 years ago, and the same error that caused that death could still happen today. In those days, the lens that we looked at such things was the medico-legal lens. Medical negligence was the term used. And right through to the mid-1990s, patient safety wasn't a recognized terminology. Medical error was the preferred way of describing such things. But as from the late 1990s onwards, patient safety emerged as a concept. And it was very helpful because it put us in solidarity with other high-risk industries. So it wasn't just a change in terminology, it was a change in the conceptual basis of how things went wrong in healthcare. And those of us who gave presentations in those days always started our presentations with an air crash. And there was a reason for that, which I'll come to in a moment, but people eventually got tired of listening to this, saying, oh, we've heard all of that before, you don't need to tell us about the parallels with airline safety, we know all about that. And so really we stopped laboring that point of comparison with the airline industry. But the reason for coming back to it today is just to remind ourselves of two things. One, aviation and other high-risk industries, not just aviation, have been highly successful in producing investigations of incidents and accidents which yield actionable findings. And secondly, the record of improvement of safety in aviation leaves healthcare in the shadows. This particular crash I put up just as a background illustration because it was still is the deadliest crash in airline history. Tenerife, 27th of March 1977, two jumbo jet 747s collided on the runway. The investigation showed multiple factors: fog, a single runway being used, informal communication terminology, pressures on the industry to meet deadlines and flight crew rest times. Multiple factors caused that incident. But the reason for coming back to it is that it led to two seminal changes in airline safety. Communication between control towers and pilots was standardized. Informal language like okay could no longer be used. And secondly, the team training, the so-called crew resource management, came into play. And this over time was the result. That's the record of airline safety that we should be comparing ourselves to. In the period I was talking about, 40, 50 years ago, you had a 1 in 350,000 risk of dying if you boarded an aircraft. By the time that we started talking about patient safety in the late 1990s, it was 1 in 0.3 million chance. And the most recent data that we have, it's 1 in 11 million. Some people have calculated statistics differently and say that if you wanted to die in an air crash, you would have to fly every day for 25,000 years to be able to match that level of risk. So the record of improvement is formidable, and they've got rarely got crashes to use as learning tools. So the irony in putting this slide up, and because it's a flight going into Geneva that recently inexplicably lost altitude, and because the pilots were trained in simulators, they remedied the fault so nobody died. But this was a big news story of a near miss, not even something that had a serious outcome. And so that's another feature of the comparison with other high-risk industries. They've got to the point when they don't learn from tragedies, because there aren't any tragedies, or very few anymore. They're learning from the sort of straws in the wind that could produce a tragedy if it's not dealt with. So this contrast with other high-risk industries is quite stark. And our health investigations of serious incidents have had relatively little impact. You could say that we're not very good at learning. And you'll find some of my criticisms this morning maybe a little bit harsh, because there is good work going on in many parts of the world, including in the Americas. But if you look industry-wide, and this is a good example from a respected body of the current safety stats, 1 in 7 Medicare patients in the hospital experience in the US suffered a medical error. And that's about the ballpark figure which is around in many, many healthcare systems. And if we look overall at the burden of disease, the yellow bar there shows that avoidable harm sits amongst diseases that we would associate as the big killers in the world: tuberculosis, malaria, HIV, and AIDS. So why is reducing the level of avoidable harm in healthcare so complex a task? Well, it's complex because the causation of unsafe care is complex. Its prevention is complex, and its improvement is a complex task. And right across the world, there are themes in the things that go wrong in healthcare, but there are also individual stories that affect real people. And in preparing for this presentation, I did a little skim of news reports around the world just in the last few months. And you'll see there a number of them. In Genoa, Italy, a man died after he was given 80 units of insulin when he should have had 8. A simple error, an extra 0 was added to the prescription so that he got that very large dose, which proved fatal. In Preston, England, in August 2023, a woman died after a 5-year delay in treating an operable brain tumor, described as failure to properly monitor scan results. In Maryland, USA, in September 2023, a low birth weight premature baby was given 4 times the correct dose of steroids, and the overdose continued for 13 days before the error was noticed. And the problem was described as a confusing system for ordering medicine. And then finally, in Minnesota, USA, in September 2023, there was a report taking stock of what had happened there on patient safety and found 21 preventable deaths and 178 injuries in the previous year. The explanation cited in the report was the ongoing complexities and challenges in our healthcare system exacerbated by the pandemic and workforce woes. So harm is out there in small amounts in relation to some causes of harm, but if you add them all up, even the rare ones, rare is quite common. So looking right across the board, the granularity is interesting, it's tragic sometimes, but it helps us to understand that we need to continue to drive, because these are real people, real events at a granular level that ruin lives and take lives and cause great harm and distress. I talked about the way that we could look at incidents, and there are a number of ways in which you can theme them, but I find the most useful way is to theme them in a way that you can match action against them. So if you look at these briefly, at these squares here, rectangles here, the purple one, error-prone processes. So we know that some incidents give us which are known processes of care that can go wrong. Wrong site surgery, diagnostic error, medication error. And what we need to do, we can deal individually with those problems, but basically we need to get better at safety assuring processes of care in key areas known to cause harm and death. If you look at the orange colored rectangle there, that I've called core resilience and protection, but there are fields like healthcare infection, falls, pressure ulcers. If you put all of those things together, then the problem really is that we haven't got a strong enough focus on implementing known protocols that protect patients from risks. And you heard a good session yesterday on healthcare infection, which emphasized that point. If you do and apply the protocols in the right way, you save lives within weeks of starting such a process. And if you look at the top there, the red lozenge, this is the rare catastrophic event that comes out of the blue. It rarely happens, but it causes serious harm. If you want to act on that, you have to recognize that many staff have never seen such an incident. So you're asking them to prevent something that they've never seen. That's not unique to healthcare. In the airline industry, many of the simulations that pilots do to correct a growing problem, they're things that they will probably never see in their entire career as a pilot, but they still rehearse in case they should happen. We don't do that in healthcare. And that's why these catastrophic events, although rare, keep happening on the same basis in the different parts of the world. If we look at the blue bar there, then we see examples of things which are incredulous to the public. For example, we were talking yesterday about cases in which medicine, which is meant to be taken by mouth, is injected, erroneously injected into veins. And then if we look at a report recently from one of the patient safety NGOs, ECRI, in conjunction with the Institute of Safe Medication Practice, they have said that they're very worried about, around the world, people bypassing barcodes in medication. So medication barcodes brought in to create a safer situation, which they have done, but if they are a nuisance to people, they're bypassing them in order to get the medication that they want. So sometimes technology solves problems, but you've got to watch for the other problems it gives. And then finally, the green one, we give little attention to the harm that can be caused by medical technology applied wrongly. And I think in the future, we need to work much more closely with the industry to try and reduce known problems of technology and machinery in healthcare which cause risk. So when we look at an incident, and I've chosen here the one that we've been very familiar with in the last few years, the failure to rescue the acutely ill person who's deteriorating, often a child, and there are people in the audience who have lost children in such circumstances. It's a very high-profile issue. But we need to remember that this is seen in different ways by the key parties involved in an incident, and this is very important. So, for example, if we look at the perspective of the family, this would probably sum up what many of them feel. We weren't listened to. She'd still be alive if they had listened. So there we're addressing the need for cultural change in order to ensure that the voice of patients and families is at the center of things. If we look from the staff point of view, when something like this goes wrong, they've got a point of view too. We're working in high pressurized environments. We're in an error-prone situation. You've got to do something to help us. And then if you look at the investigator, they will all come up with a long list of contributory factors. And we need to learn from that. But if there were 15, we don't necessarily need to learn from 15. When we looked at the Tenerife air crash, there was something like 30 errors detected, but they chose the two, the industry chose the two that would be the most transformative. The team dynamics, eliminating hierarchies in the cockpit, and then the communication between control towers and planes. So think about that as well. We talk about safer systems. I think just to everybody should note, and something that you will probably think is a very obvious statement, systems are made up of all sorts of components, all of which have their individual contribution to harm and safety and preventing harm, but they interact. So you have the governance of the organization, how the board functions, how the leadership functions, the culture, some of which I've mentioned, some of which was covered in the expert sessions, excellent expert sessions yesterday, the people side of things, the staff, the patients, the environment, the technology, and particularly in the low-income countries of the world, the lack of infrastructure makes a big contribution to unsafe care. The processes and pathways I've mentioned, and then transitions of care are very dangerous to patients. We saw this with COVID par excellence, when patients were transferred from hospitals into nursing homes, then leading to higher levels of deaths in the nursing home. There are many examples of transitions of care which need to be safety assured, and then a whole range of treatments. So just to make the simple point, each strand of these things, of that slide are important in safety, but so is their interaction and the coordination of action across them. So we need to get our staff fully engaged. I've said many, many times that we are a group of enthusiasts. How much is patient safety engaged across the board as a mainstream activity? I would say there's quite a long way still to go, despite the value of our networks and groups who are focused on patient safety. So we need individual members of staff to be curious about some of these things and investigating. We need people to talk in teams about the incidents. It's rare for that to happen other than in a formal setting, but informal communication in other high-risk industries helps to reduce risk. We need, in some parts of the world, mentoring and training to enable them on a smaller scale to look at their incidents and manage it. And most importantly of all, we need the top of the organization, the leadership, the boards, the chairs to be directly involved. So last year, I spoke at the Montreal Summit, and the Minister's office passed a message through that he hoped that it would be a scholarly atmosphere created. And as a result, I created 2 slides with Latin quotations in them, fulfilling the request of the Minister. This time, a message came, whether it was direct or indirect, I don't know. We hear an Englishman is speaking, we expect him to quote from Shakespeare. So I've thought very hard for something that was apt to the situation in front of us. And this is a scene from Henry IV, Part 1. And two characters speak to each other. Glendower says, I can call spirits from the vasty deep. And Hotspur, who was the rival to Prince Hal, who became Henry V, of course, why, so can I, so can any man, but will they come when you do call for them? And this is often taken as a metaphor for the difference between rhetoric and passionate speaking, which we need, but action. Does anything actually happen at the end of it? So I've got one more slide to show, which is my personal reflections on what might be of value for ministers to concentrate on, particularly because health ministers have considerable power within health systems, obviously because of their leadership role. So I've put 5 points here, perhaps as food for thought for ministers. First of all, the striking absence in healthcare safety compared to other high-risk industries is that there is no process for setting industry-wide standards that everybody adopts. In those other industries, when something goes wrong or when a source of risk is revealed, then there is an immediate get-together and a new way of doing things is agreed that everybody complies with. That is just never, ever happened in healthcare. So the idea of creating a mechanism for industry-wide standards in patient safety is my first thought. My second thought is to try and bring together more the health sector and to be able to talk about its problems and its risks with those who are expert in design, both in the information and digital area, in the design of products, and also in the design of soft systems. I think that would also be transformational if that happened. Why can't we, third bullet point there, why can't we pick something and say we're going to eradicate it entirely, eradicate it worldwide, just as we, in my other role for WHO, are trying to eradicate polio? Why can't we eradicate, for example, sepsis, or at least try to do it? So that would be another challenge to set everybody. And then I mentioned earlier, to try and bring patient safety, it's harsh to say it's in a silo, but I'm going to use that word, even though I know it's provocative. We need to mainstream it. There are too many doctors, nurses, other health professionals, managers who are not as switched on and passionate about it as we are. Let's try and infect them with that passion and mainstream it. And then finally, I think absolutely vital, and has been a theme of all of the summits, is building solidarity with victims of harm. So I'll leave you with one final thought, ministers in particular. As you survey your health systems and look over them in an omniscient way, if maybe not an omnipotent way, you see them, but you need to realize that in healthcare, risk is a light sleeper. Thank you for listening.
Muchísimas gracias, Mr. Donaldson, por su presentación, destacando el cambio cultural que tenemos que hacer en los países también para escuchar al paciente.
Thank you very much, sir. It's great the cultural change we need to do to try to make and have great communication to have health as an aim, as an objective. We will initiate the roundtable with the ministerial summits, and it'll go from representatives from the UK to Switzerland. Achievements, and would like to invite Dr. Osvaldo Salgado Cepeda, the current Undersecretary of Assistential Networks in the Ministry of Health of Chile, to moderate this roundtable. Dr. Please, the floor is yours, and I'd like to thank the Minister for her presence today. We know that she's got a very important meeting now, and thank you very much, Minister, for being here with us. Osvaldo Cepeda is the current Undersecretary of Assistential Networks in the Ministry of Health in Chile, and he will moderate this conversation along with distinguished leaders in safety, patient safety, and Dr. Salgado, please, the floor is yours. Okay, sir, thank you very much. Good morning. When a patient goes to a health center to solve an issue, many times, not only does he not solve the problem or issue, but ends up with some type of damage, even leading to death to a certain extent. We know that health entails risks in healthcare, but we also know that those risks are many times avoidable. Patient safety is also at the core of international conversations for a long time now, many years. The Global Assembly, more than 20 years, has called all countries to work on this, and we've seen different challenges. Safe surgery, safe medication as one of the most important procedures that aim to improve patient safety should be a main axis of sanitary policies or in health policies, and also at a local level of clinical governance. I'm privileged enough to be able to moderate this roundtable to talk about why things are so hard. We've heard the great lecture of Professor Donaldson and the prior presentation. So I'd like to rescue all of the experiences of the countries that have organized the prior summits since 2016 to 2023. There are 5 prior summits. I would like to introduce the senior leaders from your countries, which will participate in this roundtable. First place, I'd like to introduce Dr. Aidan Fowler, who is the National Director for Security and Safety in England, the position of social assistance in the health department. Hello? Professor Edgar Franke, Parliamentary Secretary of State of the Federal Ministry of Health in Germany. Mr. Akihito Isaki, Parliamentary Vice Minister of Health and Well-being from Japan. Dr. Ali Asseri, Director General of the Saudi Patient Safety Center from the Kingdom of Saudi Arabia. And Mrs. Anne Levi, Secretary of State, Director General of the Federal Office of Public Health in Switzerland. Very well, we will have the best roundtable of this event. Undoubtedly, right? Given the quality of the experts we've got. right next to us. Summits began in 2016, and we're interested in asking about some specific topics, to ask different countries about the summits that they organized. And we do not have much time. We will try to be brief, and I'd like to ask our participants to be brief. We have between 2 to 3 minutes per question, and we will have 2 questions. Therefore, the first question is for Dr. Aidan Fowler from England and the UK. The question is, how did this idea of celebrating a ministerial summit, global ministerial summit, emerge, right, for patient safety? And what was the England's aim to be the first ones in organizing this summit?
Thank you very much, and good morning, ministers and colleagues. And firstly, thank you, Chile, for hosting this fantastic summit. The then health minister for the United Kingdom was the Right Honourable Jeremy Hunt. Some of you may know he's now the Chancellor, so he now has the money in the United Kingdom. Jeremy Hunt had a very significant passion for the subject of patient safety. He was, I think, the longest serving health minister in the United Kingdom, and so he had a long time in which he spent time with patients and learnt of their experiences and with healthcare givers. And so he got to know the field very well, was incredibly passionate about the subject of patient safety, and wanted to see impact both within the United Kingdom and on the global stage. And so it was in part his vision and that of other colleagues that it would be possible and would be important to have impact on the global stage, and that indeed we have shared issues, shared concerns. And I think that's been reflected in this summit this year, which is talking to colleagues. We have shared concerns in the field of patient safety. So I wasn't present at the first meeting, but the first meeting was held in London, and everything else has come on from then. And I think from a personal point of view, as somebody who's been in post now for 6 years, so Jeremy Hunt stepped down as health minister just as I started in post, which I think is coincidental. From that point on, we have endeavored to establish a strategic approach to patient safety and to increase its profile locally. And I would see that as having been reflected across the world. So we've heard from Dr. Neelam yesterday that more countries now, and I take Dr. Tedros's point that there is further to go, but more countries now have a strategic approach, a structural approach to patient safety than they did. And I think the profile of patient safety over the time I've been in post has increased both in my local work, but I think on the global stage, the profile of patient safety has increased and the endeavors around it have increased, and that is to be welcomed.
Okay, thank you. Gracias. Preciso en el tiempo. Gracias.
Thank you very much, sir. I've been quite brief. And Professor Edgar Frank from Germany. What was the aim of Germany when requesting the annual acceleration of the Global Day on Patient Safety in the chamber, in the summit you conducted or held in Bonn?
Mr. Salgado, meine sehr verehrten Damen und Herren, liebe Kolleginnen und Kollegen, mein Nachbar hat es schon angesprochen. 2016 haben die damaligen Minister Jeremy Hunt von UK und Hermann Gröhe in London, waren die Gründungsväter des Summit, und sie haben immer gesagt, welche Herausforderungen damals schon die Patientensicherheit für uns, für die Politik bedeutet. Und für uns in Deutschland war immer
Okay, colleagues, so we faced many things in terms of patient safety. For us in Germany, it was quite clear. It's important that patient safety requires more and better attention, both between the medical staff, the patient, but also
Das war 2017. Ich muss ja mein
it's quite important for us in terms of the public perception, right? The public feel, and that
war die Idee des Bonner Appells an die Gesundheitsminister, der von Bonn ausging,
that was the idea in 2017.
der Patientensicherheit.
That's in Bonn for the health ministry, where we got the International Day for Patient Safety, to have a day where we could put at the core the patient safety in a quite separate regional manner. The importance of this idea, we've proven it in the successful campaigns within the framework of the International Day in the last years. We've encouraged people to commit with patient safety. In second place, during the pandemic, we've paid attention and the protection of staff and put at the core the education at the core, something that's a high priority for us. Ladies and gentlemen, this year the focus is on the engagement and the commitment of our patients in the political sense, also in Germany. And as we saw in the program yesterday on the agenda from this General Ministry, the General Ministry of Health from Germany, we've initiated many projects. Also at an international level, we've done projects, and these projects aim for the vision of the patient, the perspective of the patient, to be at the core of our policies and also at the core of the ministry and parliament, right? I believe that that is quite important, and that should continue being our guideline or guiding principle.
El 2018 se organizó la tercera cumbre en Japón. Y quisiéramos saber,
We would love to know, Vice Minister, representatives of social well-being would like to ask Dr. Masami Sakoi from Japan, why in the summit that you guys organized, why did you focus on the fact that patient safety is critical to achieve universal health coverage?
First of all, it's a great honor to be here to share my country's view in terms of this patient safety ministerial roundtable. And also like to thank all of my colleagues and especially the government of Chile to host this conference. I'd like to explain the line of thinking we emphasize at the Tokyo summit at that patient safety is one of the most critical components of delivering healthcare in the context of UHC. And to do so, we need to revisit the concept of UHC as described by the WHO. I recognize that the WHO says UHC with three main components. The first, all people have access to health services. And the second, they can obtain the full range of quality health services they need whenever and wherever they need. And the third, they can do so without financial hardship. Among these, the second one, concerning the full range of quality health services, underscores the importance of patient safety. This is evident as the essential first step in improving the quality of healthcare services. If this essential first step, patient safety, is missing, even if access to health services is ensured and people are protected from financial risks, it can still lead to tragic outcomes for individuals and their families and undermine public trust in the healthcare system. Therefore, at the Tokyo Summit, we stressed patient safety as an indispensable element of UHC. Our goal is to provide medical care that minimize all avoidable harm and risk, no matter who you are or where you live. Thank you.
Muchas gracias. Gracias. La cuarta cumbre se organizó
Thank
en
you
el
very much,
Reino
sir. The fourth chamber was initiated in the Kingdom of Saudi Arabia, and
conversar, preguntar
we would like to talk with Dr. We would like to ask him,
a nuestro director general del Centro
our Director General of the Saudi Patient Safety Center.
que en esa cumbre, en la declaración se
I'd like to ask him that in that summit, in the declaration, the statement, you put a commitment to advance on 11 specific points. In which of those points do you consider that we've progressed, and in which should we progress with a greater urgency?
Thank you, Mr. Chairman. And I'd like to start by thanking the Chilean Minister of Health and Government for the great summit, well organized, and has a lot of messages and science that will support patient safety. The fourth Patient Safety Summit was conducted in Jeddah, Saudi Arabia, 2019, and there were 11 points that were focused on in the final statement. I believe that, at least from the Saudi perspective, we have progressed to some extent in about half of them. And that does not mean that we are happy totally about the progress, because there is still a lot needs to be done. So one of them is to promote patient safety in LMIC, low, middle income countries. We have started or established different partnerships with some of the countries in Africa and Asia, and we extended our support, knowledge sharing, and resource sharing to improve patient safety. And we are expanding in that also. The second point is digital health. And as everybody knows, during the pandemic, a lot of progress has happened in the digital world, and that has, Saudi became sort of a huge transformation that allowed us to ensure better monitoring of patient safety and care in general, and also better accessibility. And we launched early this year, the first of its kind in the region, virtual hospital, where 180 hospitals are being served through this hospital. The third point is the classification, because we need to speak the same language among the healthcare system. So we launched the patient safety taxonomy, and that has helped to share similar definitions and language between the healthcare providers and those in the healthcare in general. We established also a reporting and learning system. We had established first national patient safety reporting or incident reporting in the country, and we are expanding also to ensure that we have that captured every aspect of data. The last point that we think we have done fairly well is workforce capacity building through training, either virtual or physical, and we are expanding also on that line. I'll just mention 2 or 3 points that I think we did not do well, at least, and we need to invest more, like patient empowerment and community engagement. This is very important. However, we need to do a lot, and I think we just established like PFAC, Patient Family Advisory Council, and we are engaging patients to some extent, but still a lot needs to be done. And we need to learn from other industries also. I don't think we are doing well in that regard, as Sir Liam said. There's a lot to be learned from other higher level organizations. Medication safety, we have a medication safety platform, but still it is one of the major factors that leading to patient safety harm. And I think this needs a lot of work to improve. Implementation is an issue. We have enough knowledge to some extent about patient safety. You have guidelines. However, when it comes to implementation, it's a real problem. So there is still a gap between what we know and what we do in real life. And I think this is something that we need to do a lot back home in this regard. Thank you.
Muchas gracias.
Thank you very much, sir.
Bueno, y después de 2 años de la pandemia nos saltamos al 2023, en que se organizó la quinta cumbre en Suiza.
Okay, we're going to skip to 2023, where the 5th summit happened in Switzerland. So I would like to ask the Secretary of State, Director General of the Office of the Public Health in Switzerland about why did you put the logo less weapons or less arms attention, right? And from the resolution or thought to application, why this mentioned?
I'm very pleased to contribute to this high-level meeting, and it's a very important exchange. And first of all, I want to congratulate Minister Aguilera and her team for the excellent organization of this summit. Switzerland was honored to host the summit in Montreux last year, and personally, I have very fond memories of this event. Our slogan, as you said, was less harm, better care, from solution to implementation. After all, awareness is largely in place and the corresponding approaches are known. However, there is often a lack of adequate and sustainable implementation. Many times, measures are not implemented at all. Now, did we succeed? I think it really allowed us to revive the momentum after a long break due to the pandemic. We managed to show how successful implementation can take place in a wide variety of areas and contexts. Very importantly, the summit in Montreux also honored the WHO Global Patient Safety Action Plan. It's difficult. Participants agreed that the action plan offers a global compass for eliminating avoidable harm in healthcare. There indeed have been some significant developments since Montreux at global level. For example, WHO conducted a comprehensive survey among member states regarding the implementation of the action plan. Its insights will be highly valuable, and we are looking forward to the final global patient safety report of 23. I would also like to mention last year's concluding document, the Montreux Charter. It clearly emphasized the relevance of implementation. The Charter received broad support from high-level delegation, which was really gratifying. Of course, we are not there yet. The implementation of measures and interventions remain a pressing topic. But all of this means that we, again, have the momentum, but of course, we need to focus to the implementation. Thank you very much.
Okay, gracias.
Okay, thank you very much, ma'am. I made a mistake when I proposed that less arms is less damage, but anyway, it was less harm. We do not have much time, but in the second round, we'd like to, in the second panel, I'd like to ask you about any national projects that are ongoing that are related with health safety. So we'd like to start with the UK and England first.
Okay, thank you. Yes, there's a lot going on, and I reflect on what Salim said about where we are compared with aviation. And I think one of the things that I've been reflecting on recently around our work is that actually we do have elements of our healthcare that achieve similar results. And actually the world of anesthetics is incredibly safe. And I think our thinking as we look to revise our strategic effort is to moving to some degree, learning obviously from error, but towards success and learning from success. So if you like, what's sometimes referred to as patient safety 1 to patient safety 2. So we do have exemplars in a number of areas. we do have areas that have achieved great levels of safety through the embracing of technology, understanding hierarchy, understanding how workforce work, and as Chilean said, the sort of crew resource management approaches. And I think we can learn from them. My colleague mentioned learning from other sectors, and I think one of the things we feel we've neglected to some extent is the safety science, human factors, and so on. So we want further to embrace those. And there are a number of new issues since the pandemic. So firstly, we learned from the pandemic that we can do things at speed. So we need to move towards working in real time. Too often in safety, we have worked in the rearview mirror, if you like, driving along. So we've learned from what's happened some time ago and acted too late. So we need to move to a world where we embrace real-time data and learning. And during the pandemic, we were able to act very quickly on issues as they arose and learned that things that used to take 6 months can happen much faster. We have new concerns around access. Access is now my most significant concern around harm because delays in care, particularly in emergency care, are much greater now with demands. So we are focusing more on flow and operations than we traditionally have, as well as traditional safety elements such as VTE and falls. And I think we are also structuring how we do safety. Safety has often been a series of projects and endeavors around a particular area. And what we've built is a system to support safety. So we have a new incident reporting system. We have national reporting. We have about 2.4 million incidents reported each year, which will go into a new system where we'll be able to embrace AI analysis of those data. We have a new approach to investigation. We've moved away from our serious incident investigation approach to working on the patient safety incident response framework, much better engagement of patients and relatives, a much more modern approach, moving away from CA. We have a new investigation body, the HSSIB. We have a patient safety commission. There are a number of structural things around training, patient involvement, and so on that are important. And I think also from the patient voice point of view, which was mentioned, we have a new policy called Martha's Rule, which will enable people in care to pick up the phone and call for a response team if they're worried about deterioration, back to Liam's mentioning of the deteriorating child. So I think there's a lot going on. I think the other thing is we have a very demoralized workforce and a narrative of failure, and we need to turn that round. So, for example, in never events, if you look at the number of retained items during surgery, compared with the denominator, the number of surgeries, we actually achieve 6 Sigma, which a lot of industries would celebrate, and yet we don't. So we need to be very supportive of our staff and focus on a more positive narrative and focus on spreading success as well as learning from harm. Thank you.
Okay. Gracias. Muchas gracias. Bueno,
Thank you so much. From Germany, perhaps you can speak about a national project in execution regarding patients' safety. You couldn't have asked this question in a better moment because in Germany now we're working in a main structural reform from the hospital's system. We spend so much money without, I don't want to mention the figures, but the quality of the final result is mediocre in a country so developed. You make many mistakes in the health system. That's why we recently approved a hospitalary transparency law, a law to promote transparency in the hospital sectors. So on this base, on 1st of May, we will publish a national atlas online of clinics and hospitals, something very special that will provide very detailed and transparent information to each person on the services and provisions that the different hospitals provide, the weaknesses, the strengthening, and the hospitals opposed to this. But it is extremely important thinking about what happens in the services, so they can be more accessible, this data in a structured way and easier to understand. We want for people to have a clear response on what hospitals are specialized. Where can I have optimal care? We have a systematized, generalized in the system, and we're also modifying financing, hospital financing. In Germany, many hospitals aim to the quantity. This is due to the fact that you wish to have care that allows more income. We finance with case groups, and hospitals always wanted to have the most profitable care, which are used as cash cows. They operate many issues regarding the spine, surgeries that were not even that necessary. Therefore, we wish to change, or better yet, to add the complement the system with independent baseline financing, regardless of the care performed, just to have these provisions available in order to put in the core the patient and not so much the economy. That's why in the future, the objective is that the services will only be provisioned in the places where proper technical equipment exists and qualified personnel for that. Not all hospitals will do everything. In our case, many hospitals were doing surgeries on patients without having the necessary experience or competences. Now, this is highly related with patients' safety and quality. But in Germany, we are also promoting a series of projects, and in the framework of the current campaign on the International Day of Patients' Safety, they are moved by the patient's implications in terms of patients' safety. For instance, a long reporting system that is also open to receive reports on criticism, but also success coming from the patients to support main issues on research and care, to have transparency in this environment, and for our system to be able to receive criticism. And that is not always so simple in the system, right? In the system where we were. And what was historically important to us, it is to support our National Alliance for Patients' Safety in the objective of providing a platform to patients in order to make their personal experiences effective as the voices in favor of patients' safety. We had a critical discussion in Germany after the pandemics, asking if everybody did a good job, and that discussion can only be channeled properly if you debate in a transparent way and also admit the mistakes you've made. I think that to us, that was extremely important. That's why Germany also advocates in a very determined way for the incorporation of patient safety in the draft of the General Program of Work from the WHO for 2025 till 2028. It is extremely important. And if anybody, I mean, if we meet as a summit every year, these results must also be communicated to the WHO, and we hope for this proposal to be supported and find support in the last negotiation round of WHO in Geneva. And I am sure that these discussions, the results of the summit, will go to the final version of this program. Thank you so much. Good, Japan. What are the experiences, the projects you've had so far? What are the projects you have?
Thank you.
In terms of our current effort to enhance patient safety, we have implemented a national system for reporting and learning from medical incidents, as my colleague, Dr. Taneda, presented yesterday. This requires healthcare facilities to report cases, which are then analyzed by an independent public agency to develop comprehensive strategies for medical process improvement. These strategies are then disseminated across the medical community to prevent future incidents. Through our national reporting and learning system, we prioritize patient safety initiatives based on collected real-world data. For example, based on the data showing that surgical errors are a leading cause of fatal incidents, we require hospitals performing high-risk surgeries to establish dedicated patient safety departments and appoint specialized staff. And we also provide financial support to help these institutions sustain their safety efforts. Furthermore, we ensure that these professionals complete training aligned with national guidelines, which we consistently update based on our research. This commitment to developing and enhancing the skills of our healthcare workers is pivotal in our national strategy for patient safety. Thank you for your attention.
Gracias. Bueno,
Oh,
y en
very
Arabia
well. And Saudi Arabia, do you have any projects, anything that you would like to share?
Thank you very much for the question. So we have, in fact, a lot of, I would say, many projects going on. It's not only in patient safety, but even in healthcare system as a whole. We have major transformation going on. So we are trying to seize the opportunity and use that transformation to help us to push patient safety as a national priority. So the the transformation will divide the healthcare system to three major arms, like the payers and the regulators and the providers. So with the payers, you are working to ensure that there will be safety-based compensation based on the outcomes related to safety. And also with the regulators, we are trying to make sure that there is a clear governance and also a rule clarification and shared responsibility and accountability. With the providers, we are working to make sure that there is a defined, clear, safe practices and commitment to and compliance with those guidelines and practices. So in short, we are working to have patient safety in the design of healthcare system to ensure that it becomes a concern for everybody in the healthcare system. We also implemented or established some of the programs, patient safety programs like maternal safety program, mental health safety or mental safety program, and medication safety program. One of the major projects we are working on is to have a single source of truth for data related to patient safety, because currently it's fragmented in different sectors. So it will be difficult to have national priorities for patient safety and to know what are the national issues that we need to focus on. And it will be also difficult to monitor progress and improvement and so on. So we are now trying to establish a data source, which will be the Saudi Patient Safety Center, that will provide, will make sure that data is comprehensive, it's accurate, valid, and available and accessible to anybody who needs to use it for improvement. It's not without challenges. We have, resistance and pushbacks, but this is understandable, and we are working with leaders and with all other authorities to make that happen. Thank you.
Gracias.
Thank you.
Bien. Y la misma pregunta entonces en Suiza. ¿Qué proyectos?
Okay, so the same question, Switzerland. What are the projects we have today that we can share?
Earlier I was talking about the progress at global level, but of course we also do it on a national level, and we wanted to benefit from the aforementioned momentum. Since the summit in Montreux, we had made progress in different areas, but I would like to focus on one topic which has already been mentioned and which is very important for us. It's the role of patients and families. And here we indeed did some progresses. With the first-hand experience, the perspectives of patients and their families are invaluable in improving patient safety. We thus mandated the establishment of an online platform to promote the involvement of patients, including information, training, and of course, networking opportunities. An impressive example is the Action Week for Patient Safety. Adhering to the topic of the WHO World Patient Safety Day, various stakeholders raised awareness for the relevance of patient and family engagement. Many prominent buildings were lit up in orange all over Switzerland. Furthermore, we are consequently enhancing digital transformation in our health system. Digital solutions have an enormous potential, as we have seen. It's a potential to improve the quality and safety of treatment in general and patient engagement in particular. Meanwhile, Switzerland is a long way from exploiting its potential, but we have taken different measures, including fostering the electronic patient record. By doing so, we improve information access and transparency for citizens. This also means more self-determination for patients. Patient engagement remains a top priority for Switzerland and also at global level. Why? Because the numbers are striking. Studies show the meaningful patient engagement has the potential to reduce the burden of harm by up to 15%. This means saving countless lives and billions of dollars each year. Meanwhile, only 13% of countries have patient representatives on the governing boards in a majority of their hospitals. Patients and families remain a hugely untapped resource for patient safety. Switzerland is thus committed to strengthening patient engagement for advancing safety in the healthcare. Our goal is to take current efforts to the next level by further promoting patient engagement in a global health policy. Switzerland engagements will be further developed in joint effort with all partners, with the WHO as the main platform. We would thus like to ask for your valuable support in our endeavor to strengthen patient engagement for advancing patient safety. Let us harness the enormous potential of patient engagement to make significant progress in our shared path towards a zero avoidable harm. Thank you very much.
Muy bien, muchas gracias. Bueno, yo les dije iba a ser la mejor mesa redonda del
Thank you.
evento.
So I told you it is the best roundtable from the event. Thank you.
Para terminar,
And thank you to the
me voy
lectures.
a permitir hacer un resumen, pero
So I'm going to make a
rescatando
summary, and I'm going to be speaking about some of the ideas I've heard about. I believe that there's a key topic that has been repeated, and it is the role of people, the population, in this topic.
las personas
How people understand, know, inform themselves, and how the system can be transparent for people to take their own decisions. That seems to be a line, a work behavior when thinking about the future that we need to strengthen.
se mencionó también
It was also mentioned the importance of the workers, the officers working, and also to support them,
capacitarlas
train
para
them
tener mejores resultados.
to have better results. And it was also mentioned the need
De ciertos
of some frameworks. Even in Germany, they say we're going to reform the hospitals because we need for patient safety issue to be involved in the structure. So there's an institutional framework, legal framework that should happen for us to improve patients' safety. Therefore, to transform this on a main axis, as has been said, finally, a calling so these experiences and these topics can be collected by WHO and promoted on a global level. I think we have achieved the objective, and once again, I thank the experts that joined us. Thank you so much.
Thank you very much.
Muchísimas gracias también al doctor Salgado, quien nos ha ayudado a aquí moderar.
Thank you so much, Dr. Salgado. You have helped us to moderate this very interesting panel. It is the best roundtable from the event. Now we're going to have a break, coffee break, but before, the heads of the delegation, please go before the coffee break, go to the area of the flags on the exit on the right side to take the official picture of the event. Outside on the right area where we have the flags, the heads of the delegation, please go for the official picture. The rest go to the coffee break, and then we'll meet in a while here. Thank you. It's not the same.
idea is to advance in open care to the patient. Why am I mentioning this? Because a couple years ago, our great focus as a country was to raise the patient safety topics in hospitals and clinics, or most of the or health centers, where many of the most severe events happen. But we're working on this, and we need to strongly focus on open health care. Now, another important point is assistential health, right? We know that when one patient either they go to the hospitals, or they go to community, or they're lowered to community assistance, there are some gaps in information transfer. When we transfer from one institution to the other, the level of care that the patient needs, and that makes us have problems with patient safety. So that's why we've got this open care healthcare approach, and to intervene the assistential cares. Now, regarding situation with patients and families, we advanced to 52%. And we can mention that Chile has regulations to open hospitals for communities and their family members. One of the examples is mentioned there, which is Hospital Amigo, or Friend Hospital. But we still need to further integrate patients and families in their decision-making process, right? To give them a voice. In addition, we also need to deepen and to continue working on the humanization of the care. But we already started working with panels, citizen panels, right? And patients that already gave us their opinions on patient safety. And they especially talked about the update of the post-care accreditation standards, which we're currently conducting now. Regarding point 5, information competences and patient safety, we have a gap here, but I'd like to comment what is this really about? Because in Chile we have a labor safety plan. We've got regulations that are safe, vaccinations for workers, the health system, etc., and we constantly train them. That is not the problem. We've got a gap in the preparation of health providers, and we need to try to intervene there for all professionals that are alumni of a university, already have knowledge in terms of patient safety, right, when they're undergraduates. So that's why we have this lower percentage. Regarding research and management, we got 60-something percentage, right? Because Chile has information security rates of some safety indicators, information technology, that all the public systems, hospitals in the country, in Chile, they report to the national institutions. And we also got information that give us the rates of inspections associated to healthcare, also consolidated at a national level. Therefore, we do have a robust information system. We've got centralized information. We've got centralized information of the entire public network, right, at a national level. Each establishment is also, by regulation, forced to have their own notification system of any sentinella or adverse effects. Therefore, they've got some informatic systems, some of them, right? And this is all telemedicine, remote medicine, and all this. There's a division that's called Digital Hospital, which has the view and the mission and vision of implementing remote healthcare services. And it's a ministerial initiative, which is quite strong. And we hope that it can be fruitful in the next years to come. Now, the challenge we have in this area is to advance in strengthening and unifying information systems at a country level. Why? Because we've got much variety of informatic systems. And it's one of the greatest challenges. Regarding synergies and association and solidarity, this is our last point, we have a low percentage. Why? Because we do not have clarity on the diagnosis of how many associations or groups of patients or other associations, civil society associations, are working on patient safety. Therefore, the diagnosis is still it's pending. And by having the diagnosis, we could have these or see these synergies in terms of patient safety. Now, I'd like to remind you that the safety culture of safety is quite important. Thanks to the agreement that we signed into with the Ford University in the US. We are going to have this information of hospitals, Chilean hospitals in the public networks. My conclusion is that Chile has a trajectory that is significant in terms of patient safety, with a strong normative, regulatory, and governance component, which has allowed the progress in terms of the installation of processes and has been spectacular results, very good results. Nevertheless, we need to advance in terms of engaging patients in security and safety and their families. We must strengthen patient safety in open health services and care trajectories and information, and to strengthen work together with the different stakeholders interested in patient safety. That is my presentation. Thank you very much. And if you have any questions, please write to my email and I'll answer it. Thank you. Thank you very much, Christian, for your presentation. Up next, we are going to talk about damage to patients given safety failures during their care. Not only do they represent a load that is potentially avoidable at a global level, but they also have a significant impact on health systems of society as a whole. In developed countries, we estimate that up to 15% of the hospital spend is focused on additional actions to try to treat the direct effects of damage to the patient. Nevertheless, we do have strategies, organizational strategies, that can significantly improve the patient safety due to a fraction of cost, of damage cost, right? We would like to invite Francesca Colongo, head of the Health Division of the Organization for Economic Growth and Development, OECD, to talk about this topic. Thank you very much.
Going back. Thank you very much. I'm really delighted to be here in this beautiful country. Delivering patient safety is obviously something which is a global imperative, but my argument is that this is not an imperative because of the huge human cost that each safety lapse produces on individuals, but because also the economic costs that this has on health systems. And so there is an important and powerful economic rationale for addressing patient safety and making this one of the key priorities of health systems. I'm not going to spend much time on this slide. It's actually showing more on the human tragedy and cost, and I think it's the same that was shown by Sir Donaldson. But I think it's quite important here to see how patient safety has harm which are comparable to HIV/AIDS or road injuries, and actually even something like 60% higher than the harms produced by tuberculosis. So obviously from a human perspective, that's something that must be addressed, and it has been talked about throughout day today and yesterday. But I think it's important to remember that there are very, very significant economic costs which are imposed on health systems due to safety lapses. For example, on average, and those are data for high-income countries, 1 in 10 hospitalization results in a safety failure, and this adds additional hospital expenditure in the order of 15%. So these can be attributed to preventable, mostly, costs which are needed to treat the failures that results from those actions. But if we look outside of the hospital sectors, there are significant costs also in primary care. In fact, some 50% of patient harms burden originates in primary and in ambulatory care. And due to some calculations that we have done, again, looking at the high-income countries, safety lapses produce additional hospitalization, additional cost that can be quantified to some 7 million avoidable admissions in OECD countries. And if we look at the elderly care sector, the long-term care sector, there are also very significant costs, which are linked to avoidable hospital admissions to hospitals due to safety lapses in long-term care. Those are equivalent to 4%, over 4% of all spending in hospitals. So the cost is actually huge. And if we put all of them together in a more comparable way, they sum up to something like 12.6% of total health expenditures, which are additional costs imposed on health system due to safety lapses and lack of safety care. Those are incredibly large, and I think it's important, again, to note they're not just in acute care, they're also quite significantly in primary care and in long-term care. And we can consider them as purely a waste of resources that could be put to work to improve actually the outcomes and to improve the experiences of care. And it makes patient safety a very important component of the agenda of value-based healthcare, because having better patient safety, on the one hand, lowers the cost of care, but on the other hand, also improves outcomes. So I would think that we need to look, and it's a powerful rationale also for ministers, that this huge waste that can be in large part preventable, but that requires actions. Not only if we look at the wider economic perspective, it really also destroys the human capital of individuals which are affected by a safety lapse. Most of them are in the labor markets or are in productive years of life. So now what can be done? I think there's been a lot that already been said, so it's difficult not to repeat. But the first perhaps things which I would like to mention relates to the fact that interventions to improve safety are actually very cost effective, and in many cases do not cost that huge. So this is just a slide that shows the results of some of the work that we have done looking at infection prevention and control. So it illustrates a different type of interventions, and it looks, when systematically implemented, what are the deaths which are averted on the left and the economic gains which are achieved on the right. And you see that the first two relate to things like enhancing environmental hygiene into institutions or improving hand hygiene. Now, these are things that, yes, they have a cost to implement, but this cost is not that huge. It's something which is affordable. It's affordable even at countries with low level of economic development. And it's a very important point, because patient safety needs to be seen not like a luxury only for the high-income countries. It's actually something which is very affordable for countries at all levels of economic development. And that's, I think, it's a first important point that I wanted to make from looking at more an economic perspective. The second point, perhaps, it's more of an opportunity that we might have, given that we come out of the biggest ever health tragedy with COVID-19. And in fact, if we look at some data, they might not be entirely comparable, but we look at the burden of unsafe care. These are data from WHO in terms of estimated dailies which are lost in millions, as well as a study that look at the equivalent burden during the first year of the pandemic. Now, there might be comparability, but again, the human cost, the cost for health system, which is linked to patient safety lapses, is quite huge. Now, right now, a lot of attention is going to making health systems more resilient in front of the possible, crisis that might arise from a pandemic or a comparable equal risks. And I think there are opportunities to bridge much more the agendas and the patient safety governance agenda with the efforts we're going to make health system more resilient, because a lot of the things that we're talking here are actually quite similar. For example, through COVID-19, we have seen the huge importance and the opportunities also to leverage more timely and more reliable data. And these accelerations in health data sets that we have seen through COVID-19 is very powerful for addressing also safety issues. So the two agendas can work hand in hand by making sure the efforts that go towards improving resilient health systems also are very much linked to efforts to achieve safety and improve patient governance. Another example is when you look at issues like leadership. Leadership is quite essential for a resilient health system. It's fundamental for patient safety. Leaderships at institutional level, at clinical level, at high level policymakers level. But there are also issues like fostering communication, fundamental in the two cases, creating a more enabling environment and atmospheres for raising concerns, for addressing unexpected harm and so forth. So I would urge perhaps bridging much more those agendas, particularly because lots of essentials now is going on how we can prevent future crises. But I think the two agendas might be bridged more importantly together. And the third message has to do with the fact that we need, if we want to make really improvements in the patient safety agendas, we need also to nurture a culture of people-centered health systems. And people-centered health systems are really the fulcrum. They are at the core, not only of high-performing health system, but also of patient safety. And that has to do both with the workers' perspective and with the patient's perspective. And some slides, again, some data that comes from analysis that we have done at OECD. We see that just 2 in 5 healthcare workers in OECD countries believe that mistakes and events reports would not be held against them. So it goes to the idea to making sure that we create that culture of no blame and transparency, which is fundamental. But I think also health professional needs to be supported much, much more, particularly again following COVID-19, in which demoralization is high. And, it's like that there needs to have not only the no blame culture, but also the systems to make sure that they can implement safety measures. And the other important element in a people-centered health systems has to do with patients. Now, there are important improvements that we see in countries. There are more and more reporting by patients themselves and their families on harms and incidents. About 1 in 6 patients report safety incidents during an episode of care, and up to 8% of patients report experiencing medication errors. These are quite significant numbers, but when we look at the implementation, the systematic implementations of efforts to involve patients, as well as patients' organizations, we see very, very large differences across countries. So the level of engagement varies, and that's something that needs to be addressed to have a much more people-centered approach to health system and to patient safety. So I will conclude with that. Huge cost of patient safety lapses, not just human cost, but also huge waste for health system. Much of this, up to 50%, is actually preventable. Measures to address those are mostly, cost effective, actually even, largely cost saving, and they're affordable for countries at all levels of economic development. So there is no excuse here. The difficulty obviously is in the systematic implementation, and that's where leadership is fundamental, the culture of openness, the improvements in information infrastructure that is so critical to have timely safety data reported, and also the support to the health workforce, not just in terms of the culture of no blame, but also to enable them to effectively handle complex environments and dynamic environments. Thank you very much.
Bien, seguimos avanzando en otros temas. La seguridad del paciente es un compromiso de todos. La participación de los pacientes
We
y
continue to move forward. The safety of patient is extremely important. The family members and the patient's opinion is extremely important in order to improve. So countries are in different phases, but we need to work together in order to promote the participation of patients in all the levels of medical care. This summit will provide the possibility to know about the experiences, knowledge, and challenges with examples on how the different experiences have become in national measurements or international global efficient measurements in order to protect the safety of patients. So I invite you to participate from this full session, and the name is The Voice of the Patient in Patients' Safety, example on how the events that people have gone through have become effective measurements to protect safety. So our first speaker is Rudy Eggers. Rudy? Dr. Rudy Eggers, the Director of Integrated Services from the Global World Health Organization. Doctor, we welcome you.
Well, good afternoon, everybody. Thank you for this opportunity to speak to you. My name is Rudy Eggers, Director of Integrated Health Services at WHO headquarters in Geneva. And the topic I'll be talking to you about is the patient voice and patient safety. As we've heard, quite an important aspect. In fact, my presentation will have two parts. The first one is really more about the WHO perspective of patient engagement and where it belongs in our thinking. And the second part is really, I want to use this opportunity today to launch the WHO Patient Rights Charter. So those are the two events on my calendar here. So why patient engagement? And of course, I'd like to draw your thoughts to our session at the end of yesterday, where we had Sue and Pradeep here, and that very powerful testimony that they gave of the work that they're doing, either as a patient or a person that is involved with patients or on the clinical side. So the patient engagement, why? Well, the first thing is, of course, it is one of the key strategies to develop a safer health system. It can reduce the burden of harm by 15% and saves billions of dollars, as we've heard a minute ago. It really is a paradigm shift from care designed for patients to care designed with patients. And we all know that this process has been ongoing for a while and really has made a step change in the way that we see healthcare. It improves quality and safety, patient experience and satisfaction, and then ultimately, of course, health outcomes. And of course, brings together the stakeholders across the board. Now, given the importance of patient engagement, it really takes a central position in the WHO Global Patient Safety Action Plan that was agreed to about 2 or 3 years ago. So in the middle of that entire document, strategic objective 4 is patient and family engagement. And it says, engage and empower patients and families to help and support the journey to safer healthcare. This is right in the center of our document, and it is an indication of the importance of this strategy. If we now look at the strategic objectives and the specific strategies that relate to it, the first strategy is about co-development. And here we talk about engaging patients, families, civil society, in the co-development of policies, plans, strategies, programs, and guidelines. The second strategy deals with learning and consulting, learning from the experience of patients and families exposed to unsafe care, to improve the understanding of the nature and harm, to foster the development of more effective solutions. The third one around capacity building for patient advocates and champions. The fourth one around incident disclosure, as we've heard repeatedly across the expert discussions yesterday. Establish a principle and practice for openness and transparency, including the patient safety incident disclosures. And then the fifth one, information and education, providing information and education to patients and their families for their involvement in self-care and empower them for shared decision-making. Now, where do we actually stand here? Looking at the survey that was done a year ago, we actually see that we truly still need to bridge the gap between intention, the things that we want to do, and the real implementation of patient engagement. Let's have a look at some of this data. We can see that only 13% of countries have appointed a patient representative in the governing board of the majority of hospitals. We can see that 24% of countries have established procedures for disclosing adverse events to patients and families. Looking at the right-hand side, the key findings, 44% have established a patient rights charter. Only 20% of countries have developed policies with the involvement of patients. Only 10% of countries have patients for patient safety networks. About half the countries of the world have procedures for patient access to medical records, and only 13% countries have initiatives to educate patients for their engagement. And of course, within these indicators, they're quite varied. Just looking at the information indicator, which is at the bottom in the bar graph, the first one looks at informed consent, and that is maybe further along. The further you go along on the right-hand side, things like disclosure of adverse events to patients is much lower. So even within those indicators, there's some variability. Since 2005, of course, we've had these WHO Patients for Patient Safety groups established in more than 50 countries, and I'm sure many of you are parts of these networks. And the vision of these networks is, of course, to devise and promote programs for patient safety and patient empowerment, to develop constructive dialogue with all partners, and to establish systems for reporting and learning without harm, defining best practices in addressing that harm. And these are really the key places where the patient voice is actually brought forward in countries. So for those countries that have as yet not established these patient networks, patients for patient safety networks, this is a great way to actually move forward. And then, of course, we had last year the World Patient Safety Day. The theme of that was to elevate the patient's voice, engaging patients for patient safety. And you will recall that that was actually quite a major event in the world. Clearly, from our perspective at WHO, we can see that patient engagement really is a central role in our organizational drive and guidance. And this really brings me to the second part of my presentation, and a very important step forward in patient engagement. So we would like to use this opportunity of this conference to actually launch the WHO Patient Rights Charter. So the WHO Patient Rights Charter is there to support the implementation of the Global Patient Safety Action Plan. It was developed in conjunction with last year's Patient Safety Day on the basis of that theme. There was a huge consultative process behind it with a diverse range of stakeholders inputting into this, and it comprises 10 patient safety rights, which we'll look at in a minute. And it really aims to affirm patient safety as a core patient right and promote a culture of safety, equity, transparency, and accountability, enabling patient empowerment. So this was part of a conference that took place at the end of last year, a global conference that was actually focusing on engaging patients for patient safety. It was a hybrid event taking place on the 12th and 13th of September, had 120 participants in the room, but you can see that more than 1,400 people participated online in this discussion. And this event featured the following: the patient and health worker stories and testimonies were brought forward. There were many panel discussions on this, both on patient and family engagements, interventions by countries, partners, and patient organizations. But then finally also a review of this patient rights charter. So the patient rights charter was the direct output out of this meeting, and the persons taking part in this meeting were really the endorsers of this charter. So without further ado, I wish I could have a fanfare. This is where we would like to launch the Patient Safety Rights Charter. And And if you'd like to have a quick look, you can just use the QR code and have direct access to the document, which has been published a day or two ago on the WHO website. I'll just leave it up for a second. So this charter actually articulates 10 patient safety rights. And let me go through them one by one. Right. The first one is the right for timely, effective, and appropriate care. The right to safe healthcare processes and practices. The right to qualified and competent health workers. The right for safe medical products and their safe and rational use. The right to safe and secure healthcare facilities. The right to dignity, respect, non-discrimination, privacy, and confidentiality. The right to access medical records. I jumped over one. The right for information, education, and supported decision-making. The right to access medical records. The right to be heard and fair resolution. And the right to family and patient engagement. So these are the mainstays of this document, the key directions we're taking. And then really starting off from this launch, we are now calling on an adoption by countries and stakeholders, basically using this multifaceted approach to advocate for these patient rights. And we would ask countries to engage stakeholders, to create legislative frameworks and regulatory mechanisms, to incorporate these into policies and professional guidelines, to create accountability, remedial and incentive mechanisms, to provide communication and advocacy, capacity building of health workers and patient advocates, the monitoring, evaluation and improvement of these rights as they go forward, further research on how they have impact, and an international collaboration and sharing of these best practices. That brings me to the end of my talk. I thank you for listening.
Muchísimas gracias de igual manera al doctor Heger por su interesante
Thank you
presentación.
so much for your very interesting lecture. It is a privilege to us having Angelina Vasquez, coordinator from the Pan American Network of Patients for Patient Safety from Mexico, that will be speaking about the Mexican situation. Thank you. Welcome.
Muy buenos días. Quiero
Good
agradecer
morning. I would like to thank for this invitation. As you see, I am representing patients, and we will be speaking about the voice of the patient for patients' safety. As you imagine, patients have suffered adverse events, and we have a priority regarding hearing our voice. We've been through a process of care that in the end caused damage. And we understand the importance of our voice, of empowering patients, of care focused in the patient. And I will be speaking about some examples of experiences that ended up in the benefit of patients' safety. So I would like to
la experiencia con un
I would like to
resultado.
connect the experience to a successful result. And for that, I need to speak about this phase, this process that means going through and living an adverse event, and in the end, to become a promoter of patients' safety. Since I'm going to be giving you some examples, I don't want to give you so many details on each one of them. I will be speaking in general of those parties that compose going through the experience and making it a benefit. And as you may imagine, the first part is really intense. There is a lot of pain, uncertainty, lack of clarity, and it puts us in emotions well, many problems, not only that requires for the connection of psychologists, psychiatrists, the families, and of course you, not as a guide, but support. It is having empathy. It is the sense of empathy on this first phase. And in this phase, I invite you to be promoters of patients' health. We're going through something very difficult. We are transforming ourselves into something new, to reconstructing ourselves as people, creating new objectives in our life after losing a family member, thinking about the capacities of this family member. We need to restate everything. The next phase, once our period mourning finishes and we get to the acceptance phase, we can continue needing the connection as colleagues. We can speak about patients' safety. And in this phase, we are going to be very feisty and we're going to scream a lot and we beg for you to listen. Please have the empathy. I know that many health professionals have also gone through adverse events, and it is the moment for you to reach us and for us to listen to each other on the third phase, which is the moderation, and to continue to listen. Something I beg you to do since the beginning, to speak with the truth on each phase. It is extremely important. To apologize is extremely important, because if we don't do this, we won't manage to go from the experience to the creation of a benefit. Why? Because we continue to live through pain forever. So not listening to the apologies, the explanations, and the truth of what happened doesn't really allow us to overcome what we went through. We feel betrayed by not knowing the truth, by not being able to have an explanation of what happened. Fortunately, scientists, experts in patient safety realize of how important patient safety is, and that in the second and third phase of the transformation is extremely important. When I heard Liam Nomelson, Dr. Leap, they allowed me to grow, to hear my mentor, Susan Sheridan, how to transform my words into words that can help to rebuild health systems. This allows me to recover somehow the trust in the value of my experience as something that it is valuable to learn. And when I saw this, check the 5 concepts to improve patients' safety, I felt happy about how important my presence is and the presence of other patients to work in the improvement of patients' safety. I will start with the examples. The example that I treasure the most is the one from Susan. Susan went through an adverse event. His kid, calf, suffers brain lesion, an injury due to an error in care, healthcare, and she has worked a lot in different initiatives. The one I thank the most is that she has supported Phil Nomison, the World Health Organization, to build Patients for Patients' Health. This is a program that it is extremely important for civil organizations working for patients' safety. We feel supported, we feel helped, we feel that we have value, and we feel the feedback there. Hile Vázquez, mother of Luis, that passed away due to an error in medication, also went through this process. And a product, among many others, was the law on patients' safety. This one, that is an extremely important tool to avoid adverse events and the specifications of what Luis went through. And so I'll be speaking about what happened to me and what we have achieved in Mexico. I am mother of Uriel that went through a series of adverse events that made him suffer side effects of acute fetal lesion and an infection associated to healthcare. The learning here was the importance of our voice. When I realized about the error, I said my blood type is not A positive, but A negative. And I thought it was going to be corrected, but I was not heard, I was not listened to, and that made that the diagnosis was wrong. There was obstetric violence. I suffered. The delivery process was very long. Fetal suffering was caused. On the first phase, he went through a brain lesion because of this. The second situation was something that was dragged because of the mistake, the error on my blood type that caused problems, and even worse to me, it was worse, an infection associated to healthcare. During this whole time, 3 times, his life was at risk, severe risk. And so I panicked and I was shouting, screaming, fainting. And I said, patience, we need to have the power to do something. And I was thinking about the empowering of the patients, the care, focus on the patients and patients' safety, but on empirical terms. We joined many mothers, many families, and we started to work. And we realized that part of the problems is that we don't have access to information. We, on the first ideas, the legal drafts, access to rights, the right to access, to our own clinical file, our record. And once the patients program was drafted for patients' safety, the London's declaration, where we were able to embed our vision, mission, and objective, and to present as colleagues, allies, opened up the doors in health systems to work in specific topics. We were able to collaborate in the global challenges. And so at some point, I adhered to the work in the improvement of the topic of the children's mothers area and the first global challenge. It was very gratifying to me having that opportunity of collaborating, not only with my experience, but with seizing the passion, taking advantage of the passion that was generated in me. It is the energy of pain, anger, and so those negative feelings that arise in me. And from there, we were able to build the Pan American Network of Patients for Patient Safety, supported by the Pan American Association of Health. And we can start to collaborate by creating documents, writing articles, collaborating in guidelines with you, experts, and diverse different researchers on patients' safety. And of course, he created the Pan American Network gives us the opportunity for feedback with different patients. And so we have two patients, lawyers.
Crear nuevas leyes, promover
Their
las leyes.
mission is to create new laws to promote the existing laws. In the case of Ronald and Mario Rios, they have worked for patients' laws, existing patient laws, to be implemented in other nations. And so we have been using a lot of energy on that. And even though we haven't achieved the implementation in many countries, this culture of rights of patients, the rights patients culture is settled somehow. So as I said, I started to work on the first global challenge, but there are other patients. There was one from Uruguay committed to the second global challenge, then with an experience in surgery where his children passed away. Randra Madrigal is working in the third global challenge, the unharmful medication without harm. And he has worked promoting alliances with pharmacists, chemical pharmacists, biologists in order to help with the barriers and to prevent adverse effects, adverse events due to a poor use of medication. This is the last case that I am very, very excited about. We have new colleagues. I will be speaking about Gabriela Covelli from Argentina, mother of Nicolas. His son Nicolas passed away. He passed away because of a terrible diagnosis error. A healthy young kid, athletic, that started to feel pain, headaches, pain in the neck, throat pain, a soaring that was just very intense, intense pain, and mistakenly was diagnosed with stress. Then, after the symptoms were very acute, there was no revision, detailed clinical revision, or tests, appropriate tests to make a proper diagnosis. And she, Gabriela, Susan, Helen, and me, in that part, we try to raise our voice to ask for tests, other opinions, and it just was not heard, just like us. And when looking at the death of his son, it was rebuilt. She got revealed and started to work by patient safety. She didn't know about us, however, got to the same conclusions that we, and received, decided to form, to act with a civil organization for life, for boys, for me, and everybody. And so I met him through this organization that groups different families, different mothers that went through the loss of their children because of errors, due to different errors in attention in healthcare, and search for support just like we do, with experts, people committed, and that is the key part, to be heard, to be with us. And so in this way, it allows us to grow and to be able to collaborate. So she promoted the law of patient safety, named Law Nicolas. So this, Gabriela is a lawyer. The vision, apart from laws, is, well, the proposal is specified as this. So this is a law that establishes a legal framework to execute the right to sanitary support, safe sanitary assistance that contains the focus of the healthcare, focus on the patient, changes in practice, on sanitary support,
de los profesionales de salud.
and professional health, the health professionals support different aspects that are extremely important to make changes. So in many of our countries, we already have the adverse events report, but I've noticed that most of them are minor incidents regarding safety, and they're very valuable because they can share in this Sentinel event, but this rare event, but if given the opportunity to study this Sentinella events is a further step, another step for the improvement of patients' health. And in this law, we integrate this. So these are the cases that I wanted to present. There are many wonderful examples from Canada, the US, different countries, but I wanted to give you a little taste due to time constrictions, and so we don't get exhausted. We do have many histories, many stories, and enough to stimulate ourselves and to continue to move forward in this adventure, this work for patients' safety. So I'd like to finish by looking at the London's Declaration, the last paragraph on London's Declaration, just to finish, in honor of those who have passed away, of those who have been, that are disabled, the children of the world that haven't been born yet. We will fight for to achieve the excellency in health, so it is as safe as possible, as soon as possible. That is the promise we've done when becoming your allies. Thank you so much for listening to us.
Muchísimas gracias, Angelina, por el testimonio y por darle también dimensión humana a estos temas que hemos discutido y que seguiremos también analizando acá y en la
We'll talk
futura.
about and that we will continue analyzing here in the future summits. We would like to invite Henrietta Hughes now to the stage, who will give us a quite important message. She is from the Security Commission of the UK, and let's please greet her with a big round of applause.
Thank you very much to the Minister of Health of Chile and to everyone here for such a fantastic event. I'm absolutely honored to be with you. When we show empathy and we listen to the voices of patients and families, we get better outcomes and we can keep patients safe. My role as the Patient Safety Commissioner for England came about because patients weren't heard and were harmed as a result. My role is independent of government and set out in legislation and started in September 22. It's set out to promote, seek improvements to patient safety and in relation the use of medicines and medical devices, to amplify patients' voices and to champion the value of listening to patients. I'm appointed by the Secretary of State for Health and I'm accountable to Parliament. This is an opportunity to share and learn from different countries, and I'm very happy to share information with you about our legislation and about my work. In the first year, we focused on patients who'd been harmed through the use of pelvic mesh and valproate. Working with fantastic patient campaigners, we were able to take a comprehensive approach to putting changes into place. It's estimated that more than 20,000 patients in England have been harmed through these interventions. So we pushed for a change in the law so patients get the right information on their medicine packets, changes in policy for monitoring the safe use of the most potent teratogenic medicines, and a single registry where 2 million devices a year, the information is held in one place so that we can get rapid feedback from patients and surgeons and recall if there are problems with these interventions. And most importantly, having patient voices included at all parts of the system, not only in terms of their own care, but also into the design and delivery of healthcare. Because this is about rebalancing the power so that patients' voices are heard and patients are seen as true partners in their care. We recently published our updated strategy and a report setting out a blueprint for options for redress for patients who are harmed through the use of medicines and medical devices. This year, the WHO theme is Elevate the Voice of Patients for Patient Safety. And I would like to tell you more about the initiative that we are piloting in England to do just that. It is called Martha's Rule, after Martha Mills, who's pictured here, a 13-year-old girl who fell off her bike while she was on holiday. She injured her pancreas and she was admitted to hospital where her condition deteriorated. Martha and her parents repeatedly voiced their concerns, asking, could it be sepsis? They were ignored and fobbed off, and her mother was told that she wouldn't receive more updates because she was emotionally compromised and it could increase her anxiety. Their worst fears were realized. Martha had sepsis. Her condition deteriorated further, and very sadly, she died. Martha's parents have called for Martha's Rule, so patients and families can seek a rapid review if they have concerns about the condition of the parent. This was inspired by the work of Helen Haskell in the USA and also Ryan's Rule in Australia. The Health Secretary asked me to run a series of policy sprints to rapidly develop policy that would make Martha's Rule a success in England. And working with a huge number of stakeholders, including patients and patient groups, the family, doctors, nurses, officials, regulators, professional bodies, and others, I made the following recommendations 18 days later. We need to have a structured approach to listening to patients in hospital. We've found from pilots that have been run by NHS England that if you ask patients who are in hospital at least once a day, how are you feeling? Are you feeling good? Are you feeling bad? Do you feel better or worse than the last time I asked you? We can anticipate a delay in the deterioration of patients 12 to 24 hours ahead of the news score going down. The next question is whether staff have 24/7 access to critical care outreach teams. We know from a hospital in London that when they introduced this, they had no cardiac arrest calls for months at a time. And the third element, which is Martha's Rule, is to give patients and families access to that same escalation route if they have concerns about the patient's condition. So a pilot was announced by NHS England to get 100 hospital sites invited to take part. Now, this is a cultural intervention. You'll notice that we didn't tell which hospitals had to take part. We invited them to step forward. And on the 1st of April, Dr. Aidan Fowler, who is here, set out an expressions of interest. And now on the 18th of April, we have over 100 hospital sites signed up. But this is more than just a process. As I've said, it's a cultural intervention. And so the Secretary of State has asked me to chair an oversight group, bringing together the patients, the family, the regulators, the doctors, the nurses, the professional bodies, and others, because it's a whole system solution which needs to come into place. We need to have all of these people involved, and we have senior sponsorship from our health secretary. Because with Martha's Rule up and running, and everybody being aware of it and being able to use it, we know that it's not just safer for patients, it's safer for staff, and it's safer for all. Cillian Donaldson talked about unleashing the power of design and building solidarity with the victims of harm. I believe that we are doing these in multiple different ways in England by listening to the voices of patients. And in summary, I would say that by working together with patients and politicians, we can build a really strong momentum. Mine is an independent voice here to amplify the voices of patients. And when the system is working collaboratively together with leadership at all levels, we can have a shared vision which can make change happen and keep people safe. Thank you so much. Muchas gracias.
Muchísimas gracias también a la señora Hughes por su
Thank you very
presentación.
much, Mrs. Hughes, for your presentation. Now, yesterday, we conducted 9 workshops focused on different crucial topics that are crucial for patient safety, from national programs to clinical challenges, going through quality assurance methodologies and active participation of patients and families. Each session was a space to exchange ideas and innovation. Moderators and co-moderators actively participated in each one of the workshops, collaborating to summarize the main conclusions and to select representatives for today, and to highlight all the ideas that we will hear about today. We would like to invite Dr. Nenan Dingra. Doctor, please, for her to give us some conclusions developed yesterday, the work done yesterday. Please, ma'am.
Good morning, dear ministers and colleagues. I'm truly grateful for this opportunity to present the outcome of 9 workshops which were conducted yesterday. These were excellent workshops which were facilitated and delivered by international experts from across the world. And I must say the key messages which I'm going to present beautifully link up with the 5 key messages which Cillian Donaldson presented, addressing to the political leaders who are present here. So coming from the 5th Global Ministerial Summit in Montreux, the Montreux Declaration on Patient Safety, which is less harm, better care, from resolution to implementation, the 6th Global Ministerial Summit takes it forward with the theme of bringing and sustaining changes in patient safety policies and strategies and practices. And I'm very deeply impressed that the program of the Experts Day of yesterday's event was truly aligned with the strategic objectives of the Global Patient Safety Action Plan. And the 9 workshops which were organized were truly based on the strategic objectives which are listed here. And as you are aware that the Global Patient Safety Action Plan has a framework of 7 strategic objectives related to policies for zero harm, high reliability systems, safety of clinical processes, patient-family engagement, health worker education skills and safety, information research and risk management, and synergy, partnerships, and solidarity. And you would see how these 9 workshops and the thematic discussion which happened is truly aligned with these objectives. So the first workshop was on national experiences, national patient safety programs. What have we learned from national experiences during the implementation of national action plans? And this dealt with the lessons learned during development and implementation of the national action plan. What type of facilitating factors are there? What are the barriers or hindrances? experiences involving patients, results, what were the successes and what were the failures, and what we learned from them, and what were the challenges and also opportunities. So the discussions beautifully brought out that globally across all WHO regions and income groups, many countries have shown a strong commitment for improving patient safety, with significant steps taken to develop and implement formal policies, strategies, action plans, and programs. Implementation strategies, though vary widely, they are tailored to fit the unique cultural, systemic, and resource environments of each health system. Common challenges included resource mobilization, resources limitations, difficulties in stakeholder engagement, and maintaining long-term commitment from all stakeholders involved. And key success factors were patient safety programs included strong leadership, clear accountability, ongoing education of all category of health workers, and effective communication. Monitoring and evaluation are crucial for assessing the effectiveness of patient safety initiatives, interventions, guiding improvements, and ensuring transparency. Regional cooperation have proven beneficial collaborations and enabling countries to share best practices and resources which enhance overall patient safety efforts. Innovation definitely plays a very important critical role in patient safety, with new technologies and methodologies emerging to improve safety and quality of care. Future trends in patient safety could see shifts in strategies due to emerging global health challenges, as well as advances in technology, and ensuring patient safety is a collective effort requiring active collaboration between governments, healthcare providers, leaders, patients, and the wider community, and all partners. The workshop 2 was in 2 parts, and it addresses the issues of national experiences in patient safety interventions and clinical challenges, childbirth and puerperium, healthcare-associated infections, care of patients with multimorbidity, polypharmacy, surgical processes involving patients and the safety of clinical process, and patient safety during psychiatric hospitalization were the topics which were broadly discussed. And it dealt with strategies implemented, lessons learned during implementation, again, facilitatory factors and hindrances, results related to failures and successes, and challenges and opportunities. A couple of important key messages which came out from these workshops were data on impact is critical to understand the problems and to make evidence-based recommendations. Research findings should guide decisions on the future of patient safety in all settings. Priorities should be set based on the risk inequities as well as on cost effectiveness, and which also beautifully was presented by the speaker from OECD, how some of the patient safety interventions have shown extremely high cost effectiveness. Sustainability of ongoing evidence-based effective programs, interventions is vital to overcome the current plateau in patient safety. And then de-escalation of ineffective practices or treatments or medicalization in general is also important in low and high income countries across the world. Patient safety interventions should focus on all social determinants of health and all settings. So not only hospital settings, but acute and primary and ambulatory care, as well as home care. And WHO to adopt the Global Action Plan on Infection Prevention and Control in 2024. It's crucial to support patients with different strategies, including education of patients on how to navigate through the complex pathways of care. And there are areas of relevance that have not yet been sufficiently addressed, such as patient safety during psychiatric hospitalization, and still action is needed, particularly focusing on pediatric mental health issues as well. The workshop 3 was on quality assurance methodologies and effects on patient safety, and what do we know about it? And it dealt with strategies implemented, learnings, experiences with involving patients, results, and challenges. And it was evident that development of norms and standards for quality assurance or at institutional level and individual levels are increasingly observed in many countries and regions, including Latin American countries. Believe in them be more frequent while scientifically assessing impact of them. And the key idea of using them for quality and safety improvement, that we make the norms and standards effective in improvement based on anticipating that they automatically bring you a good quality of care and safety. Transparency and also the importance of collective efforts were highlighted. The workshop 4 was on lessons learned by countries building and sustaining high reliability systems and organizations that protect patients from harm. This again relates to strategic objective 2 on high reliability organizations and systems and human factors and safety culture. So how to install and sustain a safety culture, develop clinical and managerial leadership capacity and capability, and address the strategies implemented, lessons learned, and results and challenges. So the key important messages which came out from this workshop was in-depth, publicly available reports on investigation of patient safety incidents are very important tools for learning, and they should be promoted. Human factor application should be seriously addressed, and safety culture should be adopted as a clear priority for high reliability health systems with key elements of leadership, safety communication, and qualitative insights. Some of the jurisdictions in Americas particularly have mandated safety culture measurement through hard regulations, and some examples were Mexico and Florida, for example, and soft regulations like Colombia and Brazil. Development of safety management system, a key area for the future, and preventive rather than reactive patient safety environment shall guide future risk management policies. And patient safety principles should be adjusted and integrated in policies to build high reliability and high resilient health systems, and particularly which systems face current permanent crisis situation. Workshops 5 were in 2 parts, and this was related to synergy and partnerships to improve patient safety and how the international organizations support the implementation of Global Patient Safety Action Plan and its sustainability, looking into experiences, collaborating with countries, challenges, achievements, and main lessons learned. And the organizations who participated, there were 2 workshops and 5 organizations, each were presenting their wide and wealth of experience they bring in. And these were International Alliance of Patient Organizations, International Council of Nurses, World Medical Association, International Confederation of Midwives, and Latin American Federation of Clinical Simulation and Patient Safety. And then the other workshop was International Society for Quality in Healthcare, Patient Safety Movement Foundation, Joint Commission International, World Patients Alliance, and International Federation of Pharmacists. And I must say it was really enriching to be part of that workshop, which spoke about promoting patient safety as a teamwork and applicable to both global and national partnerships and collaborations. A collaborative approach involves those concerned, which is healthcare leaders, professionals, patients, and the general public in key decisions. Context can vary, meaning there's no one size fits all, but sustainability requires flexibility in implementation, and networks, particularly, which was also highlighted by Dr. Eggers, patients' safety networks involving all key stakeholders, and also particularly patients who have been harmed in healthcare, patients for patient safety networks. They're extremely vital and play a crucial role in amplifying and disseminating best practices and learnings at all levels across the world. And they stimulate dialogue and share adaptable strategies, promote learning, as well as sharing of key lessons. Multiple stakeholders are active in the field of patient safety, and there's a wealth of experience and best practices and the lessons learned, which are available. Collaborative initiatives and partnerships should be based on mutual respect, trust, clear communication, and a shared vision of a common desired outcome. So a win-win collaboration is something we should aim for to achieve the desired impact. And patient safety partnerships should be multidisciplinary and multi-sectoral in composition with strong cohesive coordination, co-planning, and co-development as the foundation for success. Another important message was related to diplomacy of science. So building on all the successes of diplomacy of science in the past, patient safety has even a better chance of playing a positive and constructive role in unifying countries under its umbrella, leveraging the power of global patient safety agenda. And while talking about patient safety and its implementation in countries, important to recognize the convening power of patient safety and its positive impact on diplomacy, as well as being central to every provision of care in health system. Workshop 6 was related to national experiences working on health workforce and patient safety, again related to strategic objective 5 on experiences results in undergraduate professional technical training, results of graduate professional technical trainings, and experiences on results on health worker safety, and also health worker safety and focus on mental health, and what were the strategies implemented and learning during implementation, and results and challenges. And I must say this beautifully aligns with the WHO Charter on Health Worker Safety and the elements which are outlined in this health worker safety, with health worker safety and patient safety being 2 sides of a coin. So this workshop brought out that traditional health worker safety, which is occupational health and safety, has dramatically evolved now. And it's time and it's crucial to restore the health workforce, both sufficiency and competency and their skills and safety. All these elements have to be implemented. The whole person approach to health worker safety are necessary to staff retention and optimal performance, such as officer well-being and looking after the well-being of health workers who deliver care. Healthcare incivility like disrespect or violence persists beyond COVID-19 pandemic, and institutional confidential peer support is essential. And the shift from focus from individual resilience to system resilience with the need for resilience training was some of the key messages which came from this workshop. And finally, the workshop on data implications for patient safety, information systems implemented for decision-making at national level, addressing voluntary reporting systems, surveillance, morbidity, mortality analysis, and audits analysis of complaints and claims, lessons learned from implementation, and also transparency of information governance, results and purpose and actions taken with the information obtained, and also challenges. And this workshop specifically touches upon that for patient safety measures to be effective, evidence-based application is indispensable. Investing in reporting and learning systems is highly cost-effective at health system level, and it's must for sustainability. Integration of data, particularly the impact data for patient safety from different sources, need to be to prioritize settings at different levels of health system with a combination of human and artificial intelligence, which was beautifully elaborated in yesterday's sessions as well. And easy and usable information systems tailored to the need of different users profiles, including patients, need to facilitate reporting, analyzing, and disseminating the lessons learned. So with that, I would like to thank all of you for your attention, and my sincere thanks to all the participants, the experts, and the chairs of the working group, and for putting these key messages together so that I could deliver it for you. Thank you very much indeed.
Muchísimas gracias, doctora, por estas conclusiones, por habérselas
Thank you very
presentado.
much, Doctor, for these conclusions, for showing them to the plenary. And the idea of this is, of course, for you to travel back to your countries and for them to turn it into measures like the ones that we will receive now, because we're about to close this summit with a crucial space for commitment and action, the ministerial declarations. Each country will have the opportunity to present their commitments related with the main conclusions of this conference. Dr. Fernando Otaiza, head of Infection Control Program between 1981 and 2020, will lead this WHO and PAHO coordinator, advisor, sorry. Thank you very much. When the person that inaugurates the speech appears again, it means that this will conclude soon, so that's good news. I'd like to ask all the heads or chairs of delegations to sit in the first rows, so you have access to microphones, please. All the delegations that have been roles will have 2 minutes to express your opinions. Many of the delegations which have made different presentations, and they said that their point of view was already mentioned. They would not repeat them again, therefore they will not be named, and they were consulted individually. They will not be picked up on it. So each one of you will have 2 minutes to talk about whatever you want to talk about, but mainly we hope you focus on our topic for today, which is patient safety in your respective fields. You will have 2 minutes. When your 2 minutes conclude, you'll receive and thank you from me, which means you need to close or fix out the idea for your sentence. Thank you. That's all we will say. We'll do this in alphabetical order. I think it's easier. Therefore, the first country, please raise your hands so I can know where you are to look at you. It would be Angola. Where is the representative from Angola?
Por favor. Ahí, tiene el micrófono.
Sí, muchas gracias por la invitación. En primer lugar,
Thank you very much for the invitation. I would like to greet His Excellence Ministry of Health from the Republic of Chile, Secretary General, different ministers. I'd like to thank, on behalf of His Excellence Minister of Health, Dr. Silvia Palavalentena Tucuta, I'm here for representation of Angola. Medicine has been a concern of the Ministry of Health of Angola for a long time, and patient safety is something critical for us. In our institution, hospital institutions, we've implemented many matters related with patient safety, from proper administration of medication, the safety of surgical processes, hand washing, just like the prevention of many actions. Patient safety is something key for us. The pharmaceutical system is regulating through many legal matters within surveillance, and we've been working for safety of blood work, right? We've got technical commissions like hospital infection control. We're building high quality health facilities, and we're training more than 38,000 professionals committed with the safety of patients. On behalf of our regulation, I'd like to restate our commitment, and thank you very much on behalf of Angola.
El segundo país que va a hacer su declaración es Belice.
Now, Belize.
Adelante, por favor.
Go ahead, the floor is yours. Honorable ministers, delegates.
Good morning. It is my profound honor to represent Belize at the 6th Global Ministerial Summit on Patient Safety here in Santiago, Chile. And this summit underscored the collective dedication to an issue that is paramount to all our health systems, patient safety. Belize is a country that prides itself on the warmth of its people and the richness of its culture. It is with this same spirit of care and attention that we approach the health and safety of our patients. We are a nation committed to ensuring that every individual who seeks medical attention is met with the highest standards of care that are both safe and effective. In pursuit of this commitment, Belize have actively engaged in a transformative agenda within our healthcare system. We recognize that patient safety is not merely an aspect of healthcare, but the very foundation upon which it is built. Our strategy is multifaceted. We have initiated nationwide training and capacity building programs designed to empower our healthcare professionals with the best practices in patient safety. This ensures that they are not only competent, but also confident in their ability to provide care. We are investing in healthcare infrastructure, integrating innovative technologies to minimize risk and enhance patient outcomes. Our goal is to create an environment that facilitates precision and excellence in the delivery of healthcare services. Belize also adopted a collaborative approach, learning from international best practices and tailoring them to our unique context. And through partnerships with global institutions, we are not just participating in the global dialogue on patient safety, but actively contributing to it. We are also focusing on policy reform, aligning our national healthcare policies with international standards to ensure a robust framework for patient safety. Importantly, we are engaging our communities. Patient safety is a shared responsibility, and patient and family engagement is critical to our success. We encourage open dialogue, feedback, and the active involvement of our citizens in shaping a healthcare system that is accountable and transparent. In Belize, we understand that the journey to exceptional patient safety is continuous. It demands vigilance, innovation, and an unyielding commitment to improvement. We are here to learn, to share, and to collaborate with our global counterparts because we believe that together we are stronger and can make a greater impact. I therefore stand before you today to reaffirm Belize's commitment to this cause, a commitment to getting it right for every patient, every time. We are
Thank you.
dedicated to creating a healthcare system where safety is ingrained in every action and where quality care is the standard for every citizen and visitor in Belize. I want to thank the Minister of Health and her team from Chile and the country of Chile for the opportunity for Belize to share its vision and action towards a safer healthcare future. Together, we can and will make a difference. In closing, I want to take a piece from Dr. Fowler's presentation this morning on Shakespeare.
Thank you very
Let's
much.
make sure that when we call on those spirits, that they respond to the call. Action rather than rhetoric. Thank you very much.
Thank you very much. The next country is Bhutan. Is Bhutan here? I don't see. Okay. Following Bhutan is Botswana. Is Botswana here? Botswana, please. 2 minutes.
Thank you, Mr. Chair. Greetings to the Honorable Ministers of Health and the Assistant Ministers of Health, colleagues, all protocol is observed. On behalf of the Minister of Health, Botswana, Honorable Dr. Edwin G. Dikolothi, our message is that patient safety remains a priority for the health sector, and Botswana, as a member state of the World Health Organization, has committed to the implementation of the Global Patient Safety Action Plan 2021 to 2030. The update of the implementation of the strategic objectives are as follows. In regard to developing policies to eliminate harm in healthcare, Botswana has developed a comprehensive or is developing a comprehensive patient safety strategy, and this is ongoing with the situation analysis already having been done. Development of the strategy and implementation framework is also ongoing. We're also using relevant legislation and policies and frameworks to ensure protection of patients against harm. And to that regard, the patient and service provider charters are at the printing stage. The country is also currently developing quality management systems. Safety standards, regulations, and accreditation standards have been developed and are being implemented, with some health facilities, including laboratories, being accredited. Regulatory bodies that have been established are also there to ensure compliance to the standards. Creation of maximum awareness of patient safety to maintain a high public and political profile for patient safety. Ministers of health and senior government officials attend global summits and World Patient Safety Days. Botswana has been commemorating the World Patient Safety Day since 2020 and World Hand Hygiene Day since 2015. In regard to safety of clinical processes and establishing programs to ensure safety of clinical processes, several health facilities have been enrolled into the accreditation program and standards have been disseminated to all health facilities. Standards are being implemented to ensure that medication, medical devices, blood and blood products, vaccines, and other medical products are safe. Patient and family engagement to support safe care, engaging patients and their families. Patients are engaged in development of strategies, and patients and family rights standards are implemented to ensure patients and family involvement. Hospital advisory committees also have patient representative. Health workers education, training of patient safety is ongoing, synergy and partnerships and solidarity. Key stakeholders are involved in patient safety strategies and technical teams. So Botswana continues to recognize patient safety as a priority in health sector, using it as a platform to achieve universal health coverage. Thank you.
Thank you very much. Next delegation is Brazil. ¿Dónde?
Excelentíssimos, bom dia. Primeiramente, gostaria de agradecer à excelentíssima ministra da Saúde do Chile, Ximena Aguilera, pela excelente organização da Sexta Cúpula Global Ministerial de Segurança do Paciente.
¿Me escucha? Excelentísimos, buenos días. En primer lugar, me gustaría agradecer a la excelentísima ministra de Salud de Chile, Ximena Aguilera, por la excelente organización de esta sexta cumbre global ministerial de seguridad del paciente.
Governo do Brasil, comandado pelo presidente Lula, e o Ministério da Saúde, sob o comando da ministra Nízia Trindade, reitera aqui seu compromisso global com o fortalecimento da cultura de segurança do paciente na rede de atenção à saúde, respeitando os princípios do Sistema Único de Saúde do Brasil, de universalidade, equidade, integralidade e participação social, de maneira integrada a toda a rede de atenção à saúde. Considerando todos os entes federativos, União, Estado y municipio.
El gobierno de Brasil, bajo el liderazgo del presidente Lula y el Ministerio de Salud, dirigido por la ministra de Salud, Nízia Trindade, reitera su compromiso global con el fortalecimiento de la cultura de seguridad del paciente en la red de atención de la salud, respetando los principios fundamentales del Sistema Único de Salud de Brasil, de universalidad, equidad, integralidad y participación social de manera integrada con los entes federativos, União, Estado e município.
Entendemos a segurança do paciente na perspectiva do fortalecimento da articulação entre a assistência e a vigilância em saúde, em todos os componentes da rede de atenção à saúde, sendo a atenção primária, a atenção especializada e a atenção de urgência. Gracias.
Gracias.
Entendemos la seguridad del paciente desde la perspectiva del fortalecimiento de la articulación entre la asistencia y la vigilancia en salud en todos los componentes de la red de atención de la salud, atención primaria, especializada y de urgencia. Muchas gracias.
Muchas gracias. Obrigado. El próximo país es, porque mi alfabeto está atravesado, Australia.
Thank you very much, and I will be very brief. I just want to say I'm from Australia, and I wanted to thank the Chilean government for welcoming me as a member of the Australian population, being here at this meeting and introducing me to your beautiful country. So Australia it has all the problems that we heard about today and yesterday, and challenges in delivering high quality care to our patients and patient safety. But we are focusing on a few things that were really ring true to me today, are the diagnostic safety, which I don't think we've highlighted enough in our country, and the very critical importance about what I think is organizational culture as well as safety culture. And the two go hand in hand and can improve the safety for our patients in Australia. And then my final comment is I think what we're all facing is an increasingly complex health system, which is a good thing, but also a challenging thing. And to deliver safe care and high quality care in that environment requires us to continually improve and rethink how we deliver high quality care. So thank you very much for having me, and I've enjoyed my time very much indeed. Thank you.
Thank you very much. Next country is Burkina Faso. Burkina Faso, can we raise your hand? Okay. Next country is China. Is China here present? Sorry, I'm lost. Is China present? Yes, please. Can somebody give a microphone to the doctor, please? Welcome. Thank you very much. 2 minutes.
我是来自中国重庆的，泌尿科医生，也是医院的院长。
Very glad to meet you all, ladies and gentlemen. I'm a urologist physician from China, Chongqing, the first affiliate hospital of Chongqing Medical University. I'm also the vice president of the hospital. Very glad to meet you all.
我们很高兴能够在这次会上能呈现我们的承诺，我们一定在这10年规划里边，我们尽我们中国的努力，一定把患者安全做得更好，做得更强。
Here's our commitment in China. We will do our best to pay so much attention on the patient safety and do a lot of dedication on this. This is our commitment. Yes, please.
Thank you.
Next country, el próximo país es Colombia.
The next country is Colombia. Please raise your hand, Colombia.
Was my telephone saying that the 2 minutes were over? It's irrelevant. Okay, Colombia is not here now. Ecuador. Adelante, por favor.
Cordiales saludos a la doctora
My
Jimena.
kind regards to Dr. Jimena Aguilera, Minister of Health from Chile, Vice Minister and International Ministers International Organization, to improve the safety of the patient, OPS. So the ratification of the commitment for the construction of national policies to support the patient, also the update of manuals with humanized treatment for the patients, among others. In this summit, I get the best experiences, important alliances in order to improve the national health system in Ecuador. And also, I believe that the fire torch, that this has this heart to improve the motivation to be the main pillar in the country to have the change that we need. Thank you so much, Ministry of Health from Chile.
Internacional de la Salud por hacer el cambio que se necesita para asegurar el
colleagues, international colleagues in health to improve the health of the patient. Thank you. Thank you. El Salvador. Please go ahead. Hi. So our country is going through a difficult war violence situation. We have had a transformation in the country, and one of the most important environments is the reform of our system. The commitment to create a patient safety model with a focus on the system, to improve the processes, to generate the processes, the products and results, and the impact, of course. This is aligned to a gaps analysis. To make a gaps analysis, we need to check the causes that are generated, these huge gaps as such. Among this, we will work in the governance for the safety of the patient to improve the capacities of the teams, the knowledge and the attitudes, the safety network in general, digital transformation, to leverage quality in safety, systems of integration, different systems on root causes, and also the regulations that include the implementation plan, the rise of patients, the programs, is of course the inclusion of patient and family as a key event for safety by eliminating damaging environments that are presented for that are very important when happening errors. So different indicators and the measurement and different measurements. That is our commitment. Thank you very much. Thank you very much. Spain. Good morning to sanitary authorities in Chile, the sanitary authorities from WHO, and the rest of the countries. Spain offers universal sanitary support to all citizens in Spain with the sanitary provisions included in the national health system. Universal care can only be achieved with the safety of the patient. That's why Spain is committed to the Global Action Plan on Patient Safety 2021-2030, promoted by WHO. Clinical process safety continues to be a priority on our health national system. The safe use of medication, prevention of infection associated to sanitary assistance, ionizing radiation are immediate challenges. There's a lot of knowledge on patients' safety and a long path traveled in the Spain health system with a national strategy of patients' health, with a continuous learning on the works performed by the 67 regions and autonomous communities from Spain regarding regional plans on patients' safety, with whom we work with a work network. However, we continue to have an improvement margin in terms of safety culture and transparency. For that, Spain considers that the network is learning led by organizations leading health, and that is key. We need to speak about a common language, input requirements, collecting data, information, and also standardization and analysis of data. In definitive, we need a common work framework with active collaboration, where the narrative of patients' safety becomes a true implementation of safety culture. The 6th Global Summit organized by Chile. We congratulate you for your organization. This has given us an opportunity to learn from the rest of the country and to continue to work with patients, with citizens and sanitary professionals in Spain to guarantee sanitary attention with quality and safety with the patients. Thank you very much. Thank you. The Philippines.
Ministers, esteemed delegates, and distinguished guests, on behalf of the Philippine government, I am highly honored to stand and speak here to participate in the 6th Global Ministerial Summit on Patient Safety. As a surgeon, I was part of the WHO team that developed the Safe Surgery Checklist in 2007. I've been an advocate of patient safety even before I became Minister of Health. Now allow me to reaffirm the Philippines' commitment to uphold patient safety and reduce all avoidable harm through continuous implementation of the national policy on patient safety in all health facilities, reinforced by the Philippine National Patient Safety Program Strategic Plan of 2023 to 2028, which is aligned with the Global Patient Safety Action Plan. In 2020, the Philippines operationalized patient safety policies through various initiatives across the country. To put in place governance mechanisms, the Philippines has institutionalized a patient safety committee at the national level and established patient safety units and designated patient safety officers in health facilities. To expand capacities, we have introduced the basic course on patient safety and quality improvement, accessible online by workers directly and indirectly involved in the patient management. Further, we're deploying the advanced course on patient safety within this year. To improve our processes, we have utilized patient safety tools such as the Safe Surgery Checklist and the Client Experience Survey to elevate patient safety experience. Moreover, we have strengthened in the monitoring of patient safety indicators in key priority areas on electronic data collection and consolidation of annual reports. To expand advocacy and engagement, our annual celebration of World Patient Safety Day on September 17 serves as a platform to further expand partnerships and collaboration among our stakeholders. While progress has been made, we continue to face several implementation challenges. The culture of non-reporting of patient safety-related incidents is still prevalent due to the blame culture and fear of litigation. Additionally, disengaged leadership and governance in health facilities, often due to concerns about the program's cost effectiveness, lead to inadequate support to patient safety committees and officers. Undeterred by these challenges, the Philippines shall continue fostering a culture of safety through standard and development of patient stakeholders. Thank you very much.
Thank you very much. Next country is France, Francia.
Mesdames et messieurs
Yes,
les ministres, chers amis chiliens, merci beaucoup pour l'organisation de.
So, ladies and gentlemen, thank you so much for the organization of this summit in Chile. France commits themselves not only nationally, but also internationally to expand patients' safety. That is not only applicable to France in Europe, but the territories, even in the Americas, and also the French Guiana. I would like to send a message of positivism and optimism because in France, 20 years ago now, we have put in practice a program in order to measure the quality of health services, provisions, and also the level of safety for patients. We have collected data on the experience of patients by law. Professionals also need to report and state, declare all severe events that might present a problem or danger for the safety or integrity of patients. We have some perspectives, 3, that we would like to talk about in our following summit. 1, research. 2, work, supervision, works, and also regional work. We must have, between patients and workers, health workers, cooperation, international cooperation out of our borders. We need a growth in this. And finally, training. We, together with the Global World Health Organization, we will perform training in Lyon, French city, in order to train health professionals such as nurses. And we would like for WHO to provide further importance to training in the following summit. Thank you very much. Have a fruitful session.
Ghana. Okay, it's not here. Next, Guatemala. Adelante, por favor.
Please go ahead, Guatemala. First of all, I would like to thank the Chilean government for the invitation to the 6th Ministerial Global Summit on Patients' Safety. Madam Minister of Health, Ms. Jimena Aguilera, for your hospitality. You have welcomed us in this beautiful country. I'd like to thank also today all the experts that have shared with us these wonderful presentations, the activists that we've heard today. The struggle hasn't changed to improve the conditions of patients. Thank you so much for bringing this to this global summit. Today, we've heard about the authorities, we've heard the opinion from experts, family members, the patients of a problem that continues to exist, continues to have unacceptable indicators for humanity. Our health system still lacks of many of these elements, even though we have moved forward throughout these years, and we do have elements that can help us to improve patients' safety. We have clarity. We understand that we need to continue to work and to move forward. Today, I take a lot of work home, but I am certain that the seeds that we're seeding today will be fruitful in the future. Today, I am convinced that patients' safety, it is not only government's responsibility, but a commitment. It is a legal, moral commitment to the population. Thank you very much. Thank you so much. Ireland.
What's the name? Sorry.
Thank you for the opportunity to speak to you today at this important event and to outline Ireland's position. Ireland is committed to driving progress and best practice in quality and patient safety across the health services. With this aim in mind, the National Patient Safety Office, or NPSO, was launched in December 2016 to provide leadership and policy direction. The NPSO oversees a program of policy and legislative initiatives and collaborates extensively with key stakeholders in the health sector in Ireland. Current work streams include extending the National Clinical Effectiveness Framework, establishing a patient safety surveillance system, advancing health policy in relation to antimicrobial resistance, and continuing our work on the National Care Experience Programme and on a National Clinical Complaints Programme, to name but a few initiatives. Additionally, the NPSO supports the National Patient Safety Strategy 2019 to 2024, which is currently being implemented by the Public Health Services and is due to be revised later this year. Last year, new legislation known as the Notifiable Patient Safety Incidents and Open Disclosure Act 2023 was enacted to further embed open disclosure in the Irish healthcare sector, and a new national policy framework on open disclosure in the health and social care sectors was published. Our national patient safety priorities align very closely to the WHO's Global Patient Safety Action Plan. Ireland is committed to implementing the action plan and is working to integrate the actions into the national patient safety and quality agenda. Finally, in line with the WHO Global Patient Safety Action Plan, Ireland supports strengthening and deepening partnerships and collaborative efforts to drive patient safety in Ireland and globally. Muchas gracias.
Thank you. Kenya. Where is Kenya? Right. Namibia. Namibia is up front here. Thank you.
Thank you very much, Chair. Namibia appreciates the Global Patient Safety Action Plan of 2021-2030. Patient safety in Namibia is an integral part of our overall quality landscape. In 2022, we have developed and launched the National Quality Policy and Strategy. To implement that, we have quality standards for healthcare facilities. We have National IPC Action Plan. We have developed National Surgical Obstetric and Anesthesia Plan. We also have developed clinical death audit guidelines and revised informed consent forms and patient satisfaction tools. Furthermore, we have implemented quality improvement collaboratives that focus on improving HIV/TB services, prevention of mother-to-child HIV transmission, and maternal and newborn care. Right now, we are busy developing a comprehensive national adverse events guidelines. In closing, Namibia underscores the importance of patient safety, and we have made significant progress to ensure patient safety while receiving healthcare services. And I would like to thank the government of Chile for organizing this very important seminar. I thank you.
Thank you. Madagascar. From Madagascar, alguien? All right. Maldivas.
Peru.
Representante Maldivas.
Representatives from Maldivas, Oman.
Thank you very much, Mr. Chairman. Your Excellencies, dear colleagues, on behalf of His Excellency, the Minister of Health in Oman, I would like first to start by congratulating Chile for hosting the 6th Ministerial Summit at this beautiful city of Santiago. Patient safety is fundamental to the provision of health care in all settings. However, avoidable adverse events, errors, and risk associated with the healthcare remains a major challenge for patient safety globally. Initiatives by the Oman towards the patient safety are exemplified through the various actions, including the Ministry of Health vision is based on developing an integrated system of the healthcare that provides high-quality services with the international standards. In line with the quality assurance and control system requirement, as the quality and safety are essential in developing the healthcare system, and patient safety actually is placed high at our national agenda. The healthcare institution also in Oman have contributed to improving the delivery of the healthcare services in the level of the patient safety. And moreover, the Ministry of Health, including both the public and the private sector, have collaborated with the international institution like the WHO to develop the health policies, plans, interventions in various areas with specific objectives to operate in an integrated manner. In this regard, also, the Sultanate was selected as WHO, the first collaborating center for quality and patient safety in EMRO in 2018, as an attribute to the significant progress of the work made in the area of quality and safety for the last 20 years in Oman. And this center actually is the hub for developing and implementing patient safety tools, such as Safe Surgery, Safe for Life, Clean Care, Safe Care, patient engagement and empowerment, and the reporting and the learning system for the healthcare. To achieve all this as well, we are applying all means towards the continuity in the line of the requirement of the quality assurance and control system, and working hard toward the second goal of the SDG 2030. And closing, we affirm our firm dedication to continue to the patient safety mission, striving for zero harm in our healthcare system. And we will endorse all the ministerial declaration in this summit towards our commitments toward the implementation. Thank you very much.
Thank you. The next speaker is Japan, please.
Next speaker, Japan. Please go ahead, Japan.
Okay. Thank you for giving the opportunity, and I'm very much grateful to the Ministry of Health of Chile for hosting this magnificent summit, and to all the participants, those who have contributed their insights and expertise. Let me repeat, and as we have already acknowledged, patient safety is one of the indispensable components to achieve the universal health coverage and a policy alignment we have strived towards. Our work does not end here. It is imperative that we continuously remind every hospital practitioner, including hospital managers and clinicians, of the paramount importance of patient safety. It must be ingredient in our practices, echoed in our whole, and reflected in our care. Together, we will reinforce this message with resounding clarity and dedication until patient safety is not just a policy, but the guidance principle in healthcare across the world. Thank you very much.
Thank you. What is it, Peru?
So Peru now. Where do we have the colleagues from Peru? Please go ahead. 2 minutes. Hi. Good morning. Limo, doctor from Peru. Thank you so much for allowing us to participate from this Ministerial Global Summit on Patient Safety. Our gratitude to Minister of Health in Chile, Jimena Aguilar. I bring the regards from Mr. Vasquez, the Minister of Health from Peru. We're very pleased to have participated in this event and highly committed to transform quality and safety of patients. We are aware of the progress in the topic along this last 20 years. Peru has been working in a determined way in the promotion of patients' safety, and crediting movement have facilitated the adoption of different strategies in the topic. We are aware of the progress, but also aware that the work is not over yet. We have adopted a new vision for patients' safety, because patients' safety is a target in movement. Therefore, we need to be prepared, and that requires, first of all, a new safety culture with a big awareness, a huge awareness in what we go through on a daily basis. That is key in the development of new clinical leaders to promote this safety culture. Likewise, we have the convincement that safety gaps must be transparent, visibilized with learning reporting systems. But we believe it is key strengthening resilience on health systems, as it was mentioned very recently in our lectures. So finally, we advocate to transform health systems and patients' safety systems with an absolute holistic vision that allows to carry out the different plans on patients' safety with the aim of improving health, safety and health, and zero damage, zero harm. This is only possible with leadership and commitment that is effective. Thank you so much. Thank you. Next to speak, Portugal.
For the Portuguese Minister of Health, it's an honor to participate in this event, and we congratulate the WHO and Chile for the organization of this important summit. Sorry. Okay, let me see. Ensuring universal access to high-quality health care is a fundamental commitment of the Portuguese Ministry of Health. We are dedicated to linking access to healthcare with quality, safety, human rights, and reduce inequalities. Since 2015, Portugal adopted the National Plan to Patient Safety for the first time. This plan was updated in 2020 through the National Patient Safety Plan 2021-2026, which became mandatory following the resolution of the Council of Ministers. This update incorporates recommendations for the WHO Global Action Plan for Patient Safety. Some of our goals are to increase safety in the old care settings, including the provision of the home cares and the telehealth, increase incident notifications, reduce antimicrobial resistance, increase the involvement of the senior leaders, and introduce safety indicators on contracting of the financed activity. Achieving these objectives requires strong partnerships, just as the formations of the quality and safety committee teams in all healthcare units and the involvement of the patients and their families in the design and implementations of practical relevance and effective strategies. Our commitment, reinforced by the summit, reduce, harm, and improve health care, broadening our understanding the health and increase patients' participations, recognizing patients as an expert in their own health and lives. Thank you.
Obrigado. República Dominicana.
Dominican Republic.
Can't hear.
Dominican Republic.
Good afternoon, Sri Lanka. So thank you very much for the opportunity given to present the position of Sri Lanka in relation to patient safety. As a country, we are very happy to be partnering with WHO in drafting and co-sponsoring the resolution in 2019. As a country in 2022, we have prepared strategic directions for the medication safety as a part of the patient safety program. Back in 2013, we have introduced 20 indicators to the hospital on quality and safety, which were further strengthened by adverse events and readmission forms for monitoring mechanisms from 2016. The main University of Sri Lanka, University of Colombo, started postgraduate diploma in patient safety, and first batch of 67 doctors have completed their studies already. With that backdrop, strategic plan for Directorate of Healthcare Quality and Strategy was finalized. Therefore, our health system is now geared for adverse event monitoring and a reporting system, developing proactive culture for patient safety with an availability of healthcare accreditation system. Despite our strong commitment, many challenges faced by other countries are also common to ours as well. In that connection, resource limitations, both human resource and otherwise, difficulties in stakeholder engagement, continuous and ongoing education remain challenging. However, as a country that provides decent healthcare facilities at affordable and lower costs, we should be able to broad base our patient safety net on the long run. I take this opportunity to thank World Health Organization for its commitment on this subject, and also for the opportunity provided for all the countries to learn from best practices and also encouraging such practices to be adopted in individual countries. I thank you.
Thank you very much. República Dominicana no está, vamos a...
Dominican Republic apparently is not here. San Cristóbal de Neves.
Nadie? Bien. Singapur.
So Singapore.
Adelante.
Please go ahead.
I thank the Ministry of Health in Chile for the invitation to attend this summit. Singapore continues to recognize patient safety as a top health priority and a cornerstone of our healthcare system. Singapore reaffirms our commitment to the Global Patient Safety Action Plan 2021 to 2030 and its vision of a world in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. Ministries are uniquely positioned to act as catalysts in ensuring that the national patient safety agenda remains fresh and maintains its momentum in the face of equally pressing challenges facing us today. The Singapore Ministry of Health actively supports local healthcare providers in promoting a culture of safety in all domains of care through capability building, best practice guidance, and other resources to achieve the principles of high reliability and zero patient harm. Beyond our national policies, programs, and regulations that safeguard patient safety, the Singapore Ministry of Health also brings together stakeholders to collaborate and effect transformative, large-scale changes that address national areas of concern amidst the complexities of healthcare. We applaud collaborative efforts such as this Ministerial Summit, which provides a platform for delegations to learn and share best practices with one another. Singapore stands in solidarity with the global community in implementing the Global Patient Safety Action Plan and will remain an actively engaged partner in promoting patient safety worldwide. Thank you.
Thank you. Tailandia.
Thailand.
On behalf of the head of delegate from Thailand, we committed to maintaining patient safety as a public health issue among national priorities and support through Thailand patient, personnel, and people safety strategies. For the implementation and maintenance of the initiative generated follow the strategies of the WHO Global Patient Safety Action Plan to 2021 to 2030 to sustaining changes in patient safety policies and practice in Thailand. We will engage the leaders of healthcare institutions in the evaluation and strengthening of the safety culture and advocate for adequate resources for the implementation and strengthening of information system and research in patient safety. At the same time, we will empower patients and people to involve their self-healthcare for safety and move to be an active partner in the healthcare system, development for quality and safety. We committed to continuing the momentum generated by the Global Ministerial Summit on Patient Safety by actively participating in the and diminishing future Global Ministerial Summit on the subject. Finally, we committed to strengthening quality and safety in the healthcare system for the achievement of universal health coverage and global health security, focusing on safety not only patients but also personnel and all people in Thailand. Thank you.
Thank you. Turkey.
Turkey. Sir?
Thank you, Chair. Honorable Ministers, esteemed delegates. As we all know, at individual level, our common goal is to build a healthier and longer life. And as health policy makers and service providers, our unique goal is to build healthier societies with higher health status. To achieve both goals, the central element we need to focus on is health systems. It's the primary duty of us, health politicians, to design and renew our health systems in accordance with all kinds of expected or unexpected factors, changes, and needs. This process is inherently never-ending, and in order for health systems to provide better quality services, it's necessary to implement many approaches and practices in holistic manner. As a policymaker and orthopedist, I think that the patient safety is one of the most important factors in this quality journey, because we know that one of the most important outcomes of patient safety is surgical procedures. However, despite being so important, there are many gaps that need to be filled in many areas, such as raising the issues to higher levels in the political agenda. Creating a common language, increasing the knowledge of healthcare professionals, and establishing a health bridge between patients and employees. Lastly, I also would like to underline that unless patient safety is freed from malpractice fears and becomes the main element of the quality journey, it's not possible to get the efficiency we want in a short time. Esteemed participants, I believe that this summit, held for the 6th time, has a very significant role to this end. We shared and exchanged knowledge and thereby contribute not only to global, but also to national policy making process. Thank you.
Thank you. Zimbabwe.
Colleague ministers, distinguished guests, Zimbabwe is implementing an election.
¿Qué pasa con el micrófono? ¿Alguien puede ver? No se escucha. Go ahead. Go ahead.
Okay. Colleague ministers, distinguished guests, Zimbabwe is implementing an electronic health record system in an effort to capture all patient data pertaining to clinical assessments and decisions made, medications given, tests done, and results thereof. Our threats and challenges remain systems coverage of all modules, emerging diseases, efficient internet connectivity, ever-changing technologies, and data security. What we have learned is that incorporating patients and families in taking charge of their own health is paramount. That a culture of reporting patient safety incidences, even near misses, provide vital data for improvement, and that transparency in all health service delivery functions leads to increased staff motivation and funding partners' participation. Currently, my ministry has defined and is tracking, reporting, and rewarding facilities and staff for achieving targeted quality indicators. And this has resulted in improved accountability and reduced wastage. The 5S philosophy has reduced clutter, improved and standardized orderliness and cleanliness that has led to a reduction and control of hospital-acquired infections. All our health facility evaluations across all levels include patient and provider safety indicators. For example, every facility is assessed every quarter using a quality support and supervision tool that evaluates provision of services in line with guidelines that include safety tools. Our staff are rewarded for meeting set quality indicators, including customer feedback reports that assess staff attitude, waiting, and service time. PA hospital exchange learning visits and competitions comparing mortality and morbidity outcomes have led to sustained improvements. Many of our tertiary and central hospitals are now recording many months with no maternal deaths. All these efforts continue to provide vital data that we use for review of our patient safety policies in an effort to continually exceed expectations. I thank you.
Thank you. En este momento tengo que preguntar si es que hay alguna delegación oficial que quiera hablar y que aún no lo hace. No, bien. En un segundo. Tienen que hacer un arreglo en el escenario.
So, if there are no delegations that want to say anything further, they need to fix something here on the stage. Please be seated. And a big round of applause for all the delegations that have come here today. Thank you very much, Doctor, for moderating this intervention of all the countries. And all these ideas, commitments, desires will be noted in a chart that the Minister of Health, Mrs. Jimena Aguilera, will sign now. That chart or letter will be subsequently sent to each and every one of the delegations for you to be able to adhere or not to the commitments they're established therein. Now we're waiting for the Minister of Health to come to the stage so we can conclude this patient safety summit. Minister, along with the Undersecretary of Assistential Networks, that they're coming into the room. So would like to reiterate that we are going to sign this commitment chart here in the chamber, and subsequently each one of the delegations will receive a copy of the chart for you to adhere or not to the commitments and desires and principles that have been drafted and worked on during these last 2 days we've had in the summit. We'd like to kindly receive the Minister of Health in Chile, Dr. Jimena Aguilera.
Antes de firmarla, me parece que
Before we sign this, I think it'd be great to read it, don't you think? Global ministerial summits on patient security or safety have transformed into one of the most important international cooperation platforms. They initiated in 2016, and they've generated critical fundamental dialogues and conversations between the high levels ministers of health and stakeholders are interested in patient safety throughout these years. In this dialogue, they've been able to align policies between different countries, positioning this topic as a critical component of universal health coverage. The publication of the Global Action Plan for Patient Safety 2021-2030 of the WHO provided a roadmap for global strategies around this topic. On April 18th and 17th, 2024, representatives of 47 different countries gathered in Santiago, Chile, to share experiences on the implementation, development, and sustainability of different strategies within the framework of the 7 strategic objectives of the Global Action Plan for Patient Safety 2021-2030 in a broader framework, and to debate and agree on the key aspects to achieve change and to maintain collective efforts. Key points in the 6th Global Ministerial Summit on Patient Safety, after the dialogues of the participating countries acknowledged that, number one, global ministerial summits for patient safety account for a unique instance to exchange experience and knowledge on this topic. Number two, patient safety continues being a significant problem of public health. Despite we've got the gap that has reduced in terms of knowledge, we still have challenges in terms of implementation and sustainability of the strategies. Number three, public policies and governance frameworks for patient safety are critical elements for the application and sustainability of strategies. Number four, there are opportunities for strengthening the safety culture. Number five, significant participation of patients and family members holds an unexploited potential to reinforce patient safety. Number six, the advance and/or progress in information systems and research and this topic are still a challenge. Number seven, patient safety initiatives at all levels require greater coordination between the stakeholders. Number eight, patient safety should enshrine all the clinical processes of health institutions. Therefore, the commitment of the leadership and the development of competences of the health staff and assistential staff is it's important from an undergraduate level. Actions based on lessons learned and on dialogue generated, participating countries identify the following key points for action. Number one, strengthening public policies and the framework, the governance frameworks. Number two, to strengthen the changes paradigm to more participation of the patient and families. Number three, to engage leaders of health institutions, especially the clinicians and the managers. Number 4, to assign resources to promote research and strengthen information system. Number 5, to talk about the role of managers in different levels of coordination, different stakeholders in order to obtain the strategic objectives of the Global Action Plan for Safety 2021-2030. Based on everything and the aforementioned, the participating member countries are committed to number 1, maintain the safety as patients as a relevant public health matter that is timely, and to support sustainability of everything that's assigned according to the Global Action Plan for Patient Safety. Number 2, to maintain the drive generated by ministerial summits on patient safety, actively participating in future global ministerial summits on patient safety and supporting them. This is the commitment that I am going to sign right now. Thank you.
Bien, muchas gracias. Aprovecho este momento
Thank you
para
very much. And now I'd like to take the time to thank participation of all the delegations, to thank the organizing committee, to thank the different departments of the ministry which were engaged in this activity, the Undersecretary of Networks and the Cooperation and International Cooperation Department of the Ministry of Health. I hope you have a great reminder of your stay here in Chile and a good return flight back to your homes, to your countries. And I also like to greet all the national participants. Thank you very much.
había dejado algo en el tintero. Tenemos que
I
anunciar el
forgot something. We need to announce the next summit organizer. I'd like to invite the Minister of Health from the Philippines to please come up to the stage, sir.
y anunciar que el ministro de
I'd like to
Salud
announce that the Minister of
ser
Health
el
of
nuevo
Philippines
candidato
has accepted to be the new host country of the Global Patient Safety Summit. Do you want to say any words, sir?
Muchas gracias. Mabuhay. We all expect to see all
Thank
the
you
patients
very much.
in Manila in 2025. Thank you.
Muchas gracias, ministra. Muchas gracias al ministro de Salud de Filipinas. Todo el éxito también.
Thank you very much, Minister, and thanks to the Minister of Health of the Philippines and all the best of success for organizing the summit in Philippines next year. And thank you very much to everyone for coming. We hope that you had a great stay in Chile and that you have a great flight and return back home. Thank you very much and have a great day.
Just